everyone. Apologies, we're starting a few minutes behind schedule, but I think we're good to go. So hello, bonjour, Quay. Thank you all for being here. I would like to begin by taking a moment to reflect on and to acknowledge that the space we occupy today is on the unceded traditional territory of the Algonquin and Anishinaabe people who lived and continue to live on this land. I would also like to recognize and honor the valuable contributions of the First Nations, Inuit, and Métis people who call this land their home. When we acknowledge the land, we remember unceded means that First Nations people never ceded or legally signed away their lands to the Crown or to Canada. When we speak of traditional territory, we speak of land they or their ancestors traditionally occupied and used. This land sustained them, and as stewards, they cared for the land and the waters that flowed through them for generations before their lives were irrevocably changed through colonization and forced assimilation through the residential school system. I'll now ask the board secretary to conduct the roll call, please.
Member Banham.
Present.
Member Bauer. Member Brown-Shreeves.
Present.
Member Carr.
Present.
Member Chung.
Present.
Member Dudas.
Present.
Member Gower.
EC.
Member Kavanaugh.
Present.
Member King.
Here.
Vice Chair DiGiovanni.
Present.
And Chair Kitts.
Here.
You have quorum, Madam Chair.
Thank you. We have received regrets from Member Bauer. Are there any declarations of interest? Seeing none, can we confirm the minutes of the meeting of September 18th, 2023? Thank you. We have 7 communication items that have been received. Are those received? Motion to introduce reports. Member Gower, please.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Ottawa Public Health Update on Ottawa's Overdose Response Strategy, Update on Health Equity, Diversity, and Inclusion at Ottawa Public Health, Nutritious Food Basket 2023 and Food Insecurity Report, Ontario Public Health Standards 2023 Risk Management Report, and attendance at the Association of Local Public Health Agencies Fall Symposium be received and considered, and be it further resolved that the rules of procedure be suspended to receive and table the report titled 2024 Draft Operating Budget for the Ottawa Board of Health.
This is carried. Thank you. So we'll now move to the consent agenda. So item 7.1, Chair of the Board of Health verbal report, that will be held for verbal. 7.2, Medical Officer of Health verbal report, that will also be held. 7.3, 2024 draft operating budget for the Ottawa Board of Health. We will hold it for staff presentation. 7.4, Ottawa Public Health update on Ottawa's overdose response strategy. That will be held for presentation and delegations. Item 7.5, update on health equity, diversity, and inclusion at Ottawa Public Health. Is this item received? Thank you. Item 7.6, Nutritious Food Basket 2023 and Food Insecurity Report. Is this item received? Wonderful, thank you. Item 7.7, Ontario Public Health Standards 2023 Risk Management Report. Is this received? Great. And item 7.8, attendance of the Association of Local Public Health Agencies Fall Symposium. Is this carried? Great, thank you. The agenda also lists 3 information previously distributed memos circulated to board members in advance of the agenda, titled Strengthening Bridges Between Health and Housing Systems, Update on Ottawa Public Health's Work on the Climate Change and Health Vulnerability Assessment for Extreme Heat to Improve Community Resilience, and Ottawa Public Health Research Projects 2018 to 2022. Does anyone wish to lift one of those IPDs for discussion? Okay. Great, thank you. So we will now go back to the first held item, which is my verbal report. November is National Fall Prevention Month. Il est important de sensibiliser les gens au fall et à l'impact des blessures liées aux chutes, car cela encourage chacun à reconnaître son rôle dans la prévention des chutes et des blessures liées aux chutes tout au long de sa vie. Fall-related injuries are a serious public health issue in Ontario and can greatly impact both the individual and their family. Every year since 2011, falls have accounted for over 65% of injury-related hospitalizations among adults aged 65 to 74 and over 80% for those over 75 years. For older adults, falls are a frequent experience and have immediate physical consequences, including injuries, and represent the leading cause of injury-related emergency department visits and hospital admissions. In addition to the personal impact, falls cost Canadians $10.3 billion annually from both direct and indirect healthcare costs. Of course, older adults are not the only ones at risk of falls or fall-related injuries. 50% of emergency room visits for injured children are also due to a fall. To learn more about these risks and strategies to help prevent falls, people can visit the Injury Prevention and Safety website at ottawapublichealth.ca. November is also Radon Action Month. For those who may not be familiar, radon is a naturally occurring radioactive gas released when uranium in soil and/or rock breaks down. Studies by Health Canada have shown that radon concentrations vary a great deal across Canada. However, we know that all areas of the city of Ottawa can be affected by radon, which can seep into a building through dirt floors, cracks in foundations or concrete, sump pumps, joints, and basement drains. Well water can also contain trapped radon, which may be released into the air when water is drawn. Though radon does not tend to be a health issue outdoors, in a confined space, it can accumulate to high levels, which can present a health risk. In fact, exposure to high levels of radon gas over an extended period of time is the leading cause of lung cancer in non-smokers. For people who smoke and those who are regularly exposed to secondhand smoke, this risk is even higher. Parce que le radon est invisible, inodore et insipide, le seul moyen de savoir si une habitation est affectée par ce gaz invisible est de procéder à un test de dépistage. Et l'hiver est le moment idéal pour installer un détecteur de radon à long terme. To learn more about radon, how to test for it, and what to do about it, people can visit ottawapublichealth.ca/radon. November 7th is International Inuit Day, established in 2006 by the Inuit Circumpolar Council, an international non-governmental organization representing Arctic peoples living in Canada, Greenland, parts of the United States, and Russia. It is a global observance day to recognize and honor the Indigenous Inuit communities. Cette journée vise à promouvoir la sensibilisation et la compréhension du mode de vie des Inuits, à célébrer leur contribution, la richesse de leur culture, de leur histoire et de leur patrimoine, ainsi qu'à aborder les questions qui touchent les communautés Inuit. Celebrating International Inuit Day is an excellent way to honor and show support for the Inuit culture and heritage while also committing to understanding and addressing the issues affecting Inuit communities, such as health disparities, education, and environmental concerns. There are many resources available to learn more about International Inuit Day and related topics. Among them, the Canadian Museum of History features exhibitions and collections that highlight the history and culture of Indigenous peoples in Canada, including the Inuit. Finally, as board members know, during the 2023 Association of Municipalities of Ontario Conference in late August, the Ministry of Health unveiled a strategy to strengthen Ontario's public health sector. In addition to changes with respect to how public health will be funded through to 2025, the province is undertaking a review of the requirements for local public health units under the Ontario Public Health Standards and is supporting voluntary local health unit mergers. Recent communications from the Office of the Chief Medical Officer of Health indicate the desired outcomes include a cohesive public health system that better aligns with community and system partners to support progress on improving population health outcomes while reducing health inequities and ensuring that local public health agencies have the critical mass and capacity needed to optimize performance and meet unexpected surges in demand, as well as the skilled personnel and competencies needed to fully deliver core public health services. Étant donné que Santé publique Ottawa dessert déjà une population de plus d'1 million de personnes, nous ne discutons pas de la possibilité d'une fusion. However, we are aware that many of our neighboring health units in the East are exploring options with each other. We will continue to monitor the situation and to look for opportunities to have input into strengthening public health in Ontario. This concludes my verbal report, and I would be happy to take any questions. Seeing none, is this received? Thank you. So we'll now move on to item 7.2, Medical Officer of Health Verbal Report. Over to you, Dr. Etches.
Right, so good afternoon. Ignacio Cout, Tanche, Annie, bonjour. I will provide updates tonight on the fall respiratory illness, on measles, and on a staffing announcement. But I do want to begin. I want to acknowledge the deep sorrow, anger, hopelessness, numbness, and fear that many residents of Ottawa are feeling due to the tragic loss of life in the Middle East. I have heard that many who have survived horrors of previous global conflicts are reliving their trauma as well. Many are feeling fearful as there are dehumanizing effects of rising anti-Semitism, anti-Palestinian racism, and Islamophobia. And so part of our role in monitoring the health of our community, we're concerned as Ottawa Public Health that there are physical and psychosocial impacts of these developments on faith communities, on the broader community, and on our Ottawa Public Health staff. People need a sense of safety and security to be well in body, mind, and spirit. And so that's why, as Ottawa Public Health, you know, we work to promote inclusion and equity. We know this can improve health outcomes for all people in Ottawa. Les gens ont besoin d'un sens de sécurité pour être bien dans leur corps, dans leur tête et dans leur esprit. C'est pourquoi Santé publique Ottawa s'efforce de promouvoir l'inclusion et l'équité. And that's why over the past few weeks, I have been working to hear directly from many faith leaders, and I've explored ways to support them as they provide spiritual care to their congregations. We're working to increase access to information on how to help children cope with stressful events and to services that can address post-traumatic stress disorder and other types of mental stress. Within Ottawa Public Health, we're fostering a supportive workplace that's grounded in inclusion and care for our common humanity. We're continuing to promote social connection as a way to support our colleagues who are feeling lonely and isolated, helpless, or unsafe. So part of helping our respective communities feel safe is to be careful in the use of our words and to speak with sensitivity, considering the anguish that members of Arab, Jewish, and Muslim communities are experiencing. As a community, we must counter hate speech in all forms. And as this conflict's continuing to unfold, sadly, Ottawa Public Health will continue to monitor the mental health needs of Ottawa residents and improve what we can through respectful listening and meaningful relationship building and acting on what we learn within our scope and partnering with others to effect change. Alors que ce conflit continue malheureusement de se dérouler, Santé publique Ottawa continuera de surveiller les besoins en santé mentale des résidents d'Ottawa et d'améliorer ce que nous pouvons grâce à l'empathie, à l'écoute respectueuse et à l'établissement de relations édifiantes. Hard to move from that into talking about respiratory illness. But we do see many kinds of threats to the health of our community, and I do want to speak about respiratory illness. We're seeing levels of COVID-19 circulating in our community that remain at a high level. Respiratory syncytial virus, or RSV, activity is moderate, and it's increasing, and now we're starting to see low and increasing flu activity. The fall respiratory season does have a significant impact on how we live, work, and play, and I want to encourage people. Actually, I just said this on a different topic, but maintain social connections and physical activity throughout this fall season, because these are important to our overall health, including our mental health. At the level of the whole population, we see more protection against severe illness from COVID. That is clear, that prior infections and prior vaccination are helping us. But using our layers of protection continues to be a simple and effective way to reduce our risk of illness and decrease transmission of respiratory illness. So I'll just be really clear. What's of top concern to me is that a significant proportion of older adults have still not had an infection and are not yet taking advantage of the updated vaccines as a really important layer of protection. It was as of October 30th that all Ontario residents 6 months and older became eligible to receive their annual flu vaccine, as well as the XBB COVID-19 vaccine, that updated COVID vaccine. And as of October 30th, so at that point, it was the higher risk populations that were eligible. And we have some coverage data then that about 9% of residents 5 and older have received a COVID-19 booster dose in the last 6 months. And on that population of greater risk, it's 18% of 60 to 69-year-olds, 36% of 70 to 79-year-olds, and 38% of residents aged 80 and older who have received their COVID-19 vaccine. So I strongly encourage people over 60 to get their COVID booster and get that added coverage needed to protect against severe illness. In contrast to COVID-19, we don't have real-time measures of flu vaccination coverage among Ottawa residents. But if we're looking at comparing to last year and the uptake, what we have given, what pharmacies are giving, what we're distributing to family practices, we might expect about 50% of Ottawa adults to get vaccinated against flu, with those higher rates again in older adults. We think that probably given what we're seeing, we are, similar to last year, if not a bit further ahead. It was last week. I had the opportunity to receive both my COVID-19 and flu vaccines at the North Gore Pharmacy in the city's rural South End. It is good to get out across our wide and diverse city. And I want to thank Councillor Brown, David Brown, who joined me in that. Both the COVID and influenza vaccines are available through most local pharmacies and some primary care providers. As Ottawa Public Health isn't leading the distribution of COVID-19 and flu vaccines to pharmacies, we don't always know which pharmacies have both vaccines. Please do call ahead to ensure that there's availability of both. Ottawa Public Health, also, we are ourselves continuing to offer COVID-19 vaccine to residents in our community through neighborhood health and wellness hubs. And the flu vaccines at OPH clinics are being prioritized for children under 5 and their family members and people without OHIP coverage. Our clinics have been busy with a very good turnout of residents seeking immunization, and we'll continue to release vaccine appointments incrementally over the following weeks as our capacity allows. To support residents in under-resourced and rural areas, Ottawa Public Health is holding pop-up rural and after-school clinics for COVID-19 and flu vaccine throughout November. Pour aider les habitants des zones rurales et défavorisées, Santé publique Ottawa organise tout au long du mois de novembre des cliniques rurales et parascolaires pour la COVID-19 et la vaccination contre la grippe. So these clinics in this situation around school are drop-ins, so no appointments are needed, and information is available on our website, ottawapublichealth.ca/flu. The Ontario Ministry of Health is publicly funding another vaccine program for the RSV vaccine, newly approved by Health Canada. It is for people 60 and older living in long-term care homes, including elder care lodges and residents of retirement homes that are licensed to provide dementia care service. Ottawa Public Health is working with those eligible long-term care homes and retirement homes to help ensure that residents do have access to this vaccine and to help build capacity for immunizing the residents by providing training and resources. We are going to support a select number of homes with on-site vaccination where they don't have healthcare workers to help with that vaccine administration. Ottawa Public Health also continues to distribute rapid antigen tests for COVID to ensure that high priority populations have access to them. Santé publique Ottawa continue aussi de distribuer des trousses de tests antigéniques rapides pour la COVID-19 afin de voir à ce que les populations hautement prioritaires y ont accès. This is important so that people who test positive can access treatment in a timely manner if they're eligible. And residents are able to access these rapid antigen test kits through a number of locations across Ottawa. Many partners are helping, including local primary care providers, hospital partners, libraries. And so community clinics, we have a list on our website. So people who would like to know more are encouraged to check so they can get a test, and then when they have a positive test, they can consult their primary care provider or local pharmacist about treatment. We are continuing to focus public communications on the prevention and mitigation of respiratory illness broadly in our community, and we're working in collaboration with hospital partners, neighboring health units, and community partners to inform and align our communication products. Nous continuons à axer les communications publiques sur la prévention et l'atténuation des maladies respiratoires, et nous travaillons en collaboration avec les partenaires hospitaliers, les unités de santé publique avoisinantes et les partenaires communautaires afin d'informer et d'aligner nos produits de communication et nos actions de sensibilisation ciblées. So most recently, we communicated with parents through school boards and childcare partners, and we provided information to help them navigate this season. We also provided a social media toolkit to older adult partners. So again, trying to focus on the older adults, partners like the Canadian Association of Retired Persons, working with the African, Caribbean, and Black Wellness Resource Center, Aging in Place partners, the Champlain Region Family Council Network, and others who can get this information out to older adults. Just to wrap up on the respiratory illnesses, we do continue to see an increase in outbreaks of COVID viruses and others in our long-term care homes and retirement homes. And while these outbreaks are increasing, we know staffing remains a problem and a challenge. So we are continuing to see these situations like we would also anticipate and see in community shelters, that this is going to be a strain throughout the respiratory season. So we're working with the Regional Infection Prevention and Control Hub and partner agencies to collaborate to really maximize their support that they can have related to infection prevention and control. So I'll turn to measles briefly, just to say in mid-October, you might have seen in the news, there were 2 Outaouais residents confirmed to have contracted measles after returning from travel abroad. This was something that Ottawa Public Health was involved in notifying individuals who were exposed to measles in an emergency department, and the notifications occurred quickly after the exposure. Ottawa Public Health then supported ensuring those residents who needed it could receive post-exposure vaccination, and we've passed the period where we would expect to see secondary cases. So we're not aware of any known local transmission. I want to thank the partners who helped. Also recognize that planning exercises for a measles response occurred in March 2023, and this did help us prepare, as well as the close relationships we have with regional public health and acute care partners. It is a good reminder of the importance of keeping our childhood vaccinations up to date. So thank you to the team for working on this. Je remercie l'équipe et nos partenaires du système de santé d'avoir réagi rapidement et efficacement pour empêcher la propagation de l'infection. I'm sneaking in a little paragraph on another subject because I want to thank the province for something that I wrote you about by email recently, the vaping, Tobacco and Vaping Products Act is up for consultation, and we'll bring my recommendations to the next board meeting. But on the same topic, I want to thank the Government of Ontario for responding to the federal government's invitation to levy an additional excise duty on vaping products intended for sale in Ontario. And they're entering into a coordinated vaping product taxation agreement. This is evidence-based. Evidence shows that increases in tobacco excise taxes, and so in this case, it would be vaping products excise taxes, reduce the prevalence, initiation, and uptake of tobacco or vaping product use among young people. So price increases effectively deter the transition from an infrequent to a regular user. So I look forward to continuing to work on this subject, especially with youth, to protect from undue harms associated with smoking and vaping. So lastly, I'm looking over to welcome and introduce Casey Whitaker, who is in the room. On October 16th, Casey joined Ottawa Public Health as the incoming Coordinator Legislative Services. Over the next 2 months, she'll be transitioning into the role in anticipation of Diane Blais' retirement in January. So, au cours des 2 prochains mois, Casey assumera cette fonction en prévision du départ à la retraite de Diane Blais en janvier. Casey has more than 10 years of experience in municipal government, having worked most recently as the Deputy Clerk and Emergency Management Coordinator for Lanark County. In this role, she was responsible for supporting the county clerk to ensure good governance in Lanark County, and that included developing and distributing bylaws, resolutions, agendas, minutes, correspondence, and reports necessary for the smooth functioning of municipal council and committees. And she also developed and implemented the county's emergency preparedness strategies. So in her new role here at OPH, Casey will lead the daily activities required to support the board in fulfilling its duties under the Ontario Health Protection and Promotion Act and the Ontario Public Health Standards. So this will include supporting the chair and ensuring the timely publication, distribution of agendas, minutes, motions, and other related documents, and the orderly functioning of the board's public and in-camera meetings. So please join me in welcoming Casey to the team. Bienvenue à l'équipe, Casey. We will take more time to recognize Diane Blais in the future, so she's not gone yet. This concludes my verbal report. I would be happy to take any questions.
Councillor King or Member King.
Thank you, Chair. And I don't have a question per se. I just wanted to commend the staff of public health who are staffing our neighborhood health and wellness hubs. I had the good pleasure of attending one for immunization this weekend at the Réunion Community Hub. And I was impressed. I could not go immediately, so I went in the morning and had to come back. But I saw the large numbers of people who were participating. So I think I heard a staff member say that was a record today. And what was also heartening was seeing many immunizations of children, multiple children who were coming in. So I just wanted to say it's a strong, mighty, and there was a small staff complement there. But I want to thank them for the work that they are doing. Thank you, Chair.
Thank you very much, Member King. Vice Chair DiGiovanni, please.
So similarly, not a question, but more of a statement of thanks to the OPH staff. We very quickly in the consent agenda took in a lot of reports for information, but they were really well done and really kind of demonstrate what happens in the background of OPH to just keep moving forward on our priorities. And I just thought that was worthy of a second to acknowledge, because we really do appreciate it, even though we whiz by it on the consent agenda. It's well done.
Thank you very much for that well-deserved recognition, Vice Chair. Member Carr, please.
Yeah, thanks. I just want to echo Vice Chair Giovanni's comments, but particularly on the food security item. I was really impressed with the work that was done there. It is something that is a big preoccupation of mine, and I'm certainly hoping when the budget is tabled on Wednesday morning for City Council, that we see an increase in the amount of money that goes to help some of these organizations through the Sustainability Fund. And it's just such a critical item, and it really highlighted the fact, and one thing that still continues to strike my attention is the fact that we are the only G7 country without a school lunch program. So certainly something I'm hoping to see them implement. And I'm sorry I missed the opportunity to bring the item to attention. So I just wanted to acknowledge all that great work now. And it's, I know in my community, I've got the Heron Emergency Food Center and along with 3 other food banks, and the statistics are just unbelievable. The amount of people that they're seeing, particularly as we welcome new Canadians and as well people that are really having a hard time in the financial crisis. So thanks very much for that work.
Thank you, Member Carr. Not seeing any other, oh, yeah, Member Banham.
I just wanted to say thank you, Dr. Etches, for expressing so beautifully what a lot of people are feeling and seeing in the community around what is occurring in the Middle East. And you brought up that Ottawa Public Health is helping with some resources to help children cope with stress. And I was just hoping that that could be circulated, because I think it would be really helpful for a lot of parents right now.
Yes, we can do that. Absolutely. Thank you. I'm not seeing,
So we have a website right now, and we're adding to it, and we're also looking at particular targeted conversations that could happen in the community as well, working with partners. CHEO also has some good resources, and we're looking to partner with some of their experts too. So I shouldn't say that, maybe it's work in progress, but yes, thank you.
Thank you.
thank you. Thank you, Dr. Etches. I'm not seeing any other hands, so I'll just echo what some of the board members said. A big congratulations to staff for your work on these reports and the level of detail in them. And also, I think we're very lucky to have such an empathetic medical officer of health leading us. So thank you, Dr. Etches, for your verbal report. A warm welcome to Casey. We're all looking forward to working with you. And with that, can we receive the report? Great. Thank you. We will now move on to item 7.3, the 2024 draft operating budget for the Ottawa Board of Health. So we will have a presentation and documents are being circulated to members in person. And I believe those that are joining virtually, you will be sent the documents digitally as well.
So we have in front of the board two of our leads around everything financial. So you've met Sam Gossa before, and I know you were introduced also to Kibriya Mohammed. So we appreciate them being here, and others behind the scenes, really making sure that we understand and you can approve what is needed to carry out all of this work. So this is one of the foundational roles of the board in terms of supporting the resources to carry out our mandate. So thank you both.
Honorable Chair, board members, my dearest OPH team, and distinguished members of the community.
Kibria, sorry, could you just go a little bit closer to the microphone?
Sorry,
Just a little bit closer to the microphone. Yeah, great. Sorry about that. Thank you.
can you hear me? Okay. Shubho Shantha, Boswa, Unuhat Khut, Masal Khair. Good evening. I'm honored to present Ottawa Public Health's 2024 draft operating budget tonight. The proposed operating budget is grounded on evidence related to population health needs and the past year's learning. OPH's strategic goals and mandates established by the Board of Health in June 2023 and the provincial standards, and input from Ottawa community members, partners, and the OPH team. The resource allocation plan was driven by a commitment to advance equity, diversity, inclusion, and reconciliation with First Nations, Inuit, and Métis people. While dedicated provincial COVID-19 funding is coming to an end in 2024, and OPH has been steadily decreasing COVID-19 spending since the January 2022 peak of the Omicron variant, the budget continues to support agility, preparedness, and recovery that is prevention-oriented and population-focused. Next slide, please. Tonight's presentation will include 2024 operating budget highlights, the directions and assumptions on which the budget was developed, key steps taken to develop the 2024 operating budget, 2024 operating budget breakdown, including a summary of budget changes, and budget timeline. Next slide, please. This slide touches on the key highlights of the 2024 operating budget. First, we are tabling a balanced budget of $87.5 million. Second, we are focused on returning to breadth of public health services, including chronic disease and injury prevention, promoting mental health and substance use health. Third, we are thankful to the City of Ottawa for the annual inflationary increase in municipal contribution, which helps to maintain public health programs and services. Fourth, we are also thankful to the Provincial Ministry of Health for restoration of some of the base funding and an increase of 1% to our base budget. Fifth, we leveraged our experience from the last 3 years to maintain public trust and to build pathways to culturally safe and equitable services, recognizing the unique needs of the populations that we serve. Sixth, we are seeking guidance from the board to build strong partnerships and seek opportunities for growth to meet community needs. The directions and assumptions on which we have built our budget are outlined in the next slide. Our proposed budget is aligned with 3 municipal and provincial directions. First, the Ottawa City Council requested the Board of Health to develop OPH's draft operating budget based on 2.5% tax-supported annual increase in municipal funding, plus a growth allocation, which contributes to maintain OPH programs and services. Second, the province has restored provincial contribution to the cost-shared base budget for provincially mandated programs and services an amount of about $3.1 million provided as temporary mitigation funding in 2019 to 2023 budgets. The temporary mitigation funding was offsetting their policy approach to reduce provincial contributions to public health units' cost-shared base budget. That policy approach has been reversed. Third, the province has also announced a 1% annual increase in provincial funding to the cost-shared base budget for provincially mandated programs and services for 3 years that begins in 2024. These measures, along with our efforts to find efficiencies in our non-compensation budget, helped us to address budget pressures created by cost of living and benefit adjustments determined by collective agreements, inflationary increase in facility lease, technical contracts, and fleet costs, and expenses associated with the implementation of cannabis legislation. Next slide. The 2024 operating budget is developed based on few assumptions. First, we assume the province will offer the opportunity of one-time within-year funding to further support OPH programs and services. Second, we assume provincial support will improve access to primary health care, including mental health, harm reduction, and opioid crisis response services. Connecting residents to primary care, including for mental health and substance use health supports, remains a challenge in Ottawa and across Ontario. These unmet health needs are resulting in increased pressures on OPH programs and services, especially related to routine immunizations, early detection and continuity of care related to communicable diseases, and access to mental health and substance use health services. Furthermore, OPH's capacity to complete catch-up immunizations for people without access to primary care providers will be minimal, as the community immunization clinics will end in 2024. Third, we assume the federal, provincial, and municipal investment will grow to enhance programs and services addressing the housing crisis and social determinants of health. The unmet need in social services, especially in housing, has been contributing to deteriorating population health, particularly among high homeless population and precariously housed families, resulting in increased demands for public health services. Next slide, please. So go back to previous one. Fourth, we assume the province will invest in technology to support an efficient and effective public health information management system. The public health sector is technologically behind the healthcare system, limiting our ability to digital engagement and collaboration with clients and key sector partners like Ontario Health Teams due to the absence of a centralized, coordinated digital strategy for local public health units in the province. Next slide, please. This slide summarizes our approach to developing a balanced budget by adopting an evidence-based, systematic, and transparent process. Our process started with prioritizing services to address population health needs. We carried out population health assessments and diversity audits. We reviewed provincial standards and OPH's strategic goals and mandates established by the Board of Health in June 2023. We also engaged with community members, partners, and OPH staff to accomplish this objective. Next, we reallocated resources to deliver prioritized services through an internal review that includes reallocation of positions funded by the base budget to address ongoing areas of workload pressure, such as infection prevention and control and environmental health. Next, we identified budget pressures by reviewing the 2023 expenditure plan, analyzing different scenarios of revenue forecasts, and assessing the implications of pressures on programs. At last, we developed strategies to address budget pressures through discussion with OPH leadership team members, Ministry of Health, and city counterparts. We also conducted a thorough review of our non-compensation expenditure plan to improve efficiencies. Next slide. This slide represents a high-level summary of Ottawa Public Health's 2024 operating budget, with key changes from the OPH's 2023 approved operating budget. For 2024, we are presenting a balanced operating budget of $87.5 million, which is broken down as an $80.7 million base budget to support provincially mandated programs and services, and a $6.8 million one-time budget to support the COVID-19 immunization program wrap-up in Q1 2024. Out of $80.7 million base budget, $67 million is a cost-shared base budget, which is shared between the province and the city. And $13.7 million is a base budget 100% funded by city and the province. Out of $13.7 million 100% funded base budget, $5.4 million is funded by the city and $8.3 million is funded by the province. A total of 511.11 full-time employees, a number that remains unchanged from 2023, will remain funded by their base budget. The 2024 operating budget submission is $43.9 million lower than the 2023 approved operating budget, mainly due to the ending of dedicated COVID-19 operations by Q1 2024. Next slide. The draft operating budget is balanced by revenues that include $55.8 million from the province, $1.3 million from other sources, for example, inspection fees, $28.2 million net revenue contribution from the City of Ottawa. The city and the province have increased their funding by $1.6 million together to support OPH's 2024 base operating budget. Next slide. This slide represents the budget approval timeline. After tonight's meeting, the BOH budget will be tabled with City Council on November 8 and then returned to the board on December 4 for public delegations and approval. There will be opportunities for public feedback throughout the month of November, with further discussion at the City Council meeting on December 6, 2023. I want to express my deepest appreciation to our OPH finance team members, Sam and Heather, for their tireless and tremendous efforts in bringing this budget to life. I'm very grateful to OPH's senior leadership team members, managers, supervisors, and staff for their guidance, support, and timely response to queries over the last few months. I had the pleasure of collaborating with our colleagues at FSU. Svetlana and Elizabeth, thank you for your hard work and support. I want to thank our Ministry of Health colleagues for their timely guidance and support. I'm very thankful to the residents of Ottawa for their continued engagement and support. And lastly, we are very thankful to our board for your continued guidance and support. We welcome any questions at this time. However, board members can send out their inquiries to Diane, and the residents can comment on the budget via the email at healthbudget@ottawa.ca. Maxi, Nagormik, Miigwech, Shukran, Dhonnobad. Thank you.
Thank you so much, Kibria, Sam, Heather, and team. So we will go to questions from board members, but a reminder that only high-level questions on the presentation will be in order at this meeting. Detailed questions, motions, discussion, and debate on the content of the draft operating budget will be held until the subsequent meeting on December 4th. Okay, great. We'll go to Member Dudas.
Thank you, Chair. Just a high level then, happy to stay in that realm. I was curious, our city's growing, the area's growing. And once again, we've seen a change in need because of a de-escalation from the pandemic and our response as OPH. But I was curious as to whether you're anticipating that there'll be an increased demand for resources, city staff or OPH staff, budget resources in the coming years that we can anticipate because of population growth or because of more vulnerable communities requiring additional services.
I would say yes, we see a need for a growing budget into the future as our population grows, as the health needs grow, the complexity of what many of our teams are facing is greater and greater, whether it's the home visiting nurses or supporting congregate care settings with infection prevention and control. We've planned for this. It's in our 2024 budget. It's why we've reallocated resources to areas of pressure. And Kibria may want to speak to how we're also going to go further and look for additional funding from different sources to try to address higher levels of need. And we see an opportunity to discuss this with the province as they are reviewing the funding formula for our public health sector as a whole. So we would be bringing that up as they're looking at that in the future. But anything else you want to add at this point?
Thank you, Vera. So as you have seen, actually, our budget increase from the revenue increase from the city and the province is not enough to grow our program. It's just to maintain our routine services, but we do expect an increased pressure on our services, and we came up with a multi-pronged strategy to deal with this. You will find more details in the budget report that we submitted. One of the strategies to increase our revenue by applying to one-time funding. We are also going to take part in consultation with the Ministry of Health in their review process, where they committed that they will review the provincial formula, provincial and municipal cost shared formula. And we want to strongly advocate that the provincial contribution should be more equitable across different municipalities.
Thank you. You actually hit on what was going to be my next question. I was going to ask about the provincial contribution, so I won't belabor the point, but I'm glad you connected the dots on my questioning. So I do appreciate that. Thank you.
Thank you for the question, Member Dudas. Well, certainly advocacy will be a focus, I think, in the year ahead. Member Kavanaugh, please.
Thank you very much, and thank you for your presentation. It sounds like we're getting back to business, to what our core business is as public health. So that's good news. You did mention about wrap-up funding for COVID-19, and we all hope that's true. Is there any kind of expectation or promise from the province that if it's not a wrap-up, we're going to continue to see a stream if it's necessary?
You know, this is the case that we're looking at how to fit all of our work, whether it's COVID or not, in our base budget going forward. Kibria alluded to the fact that there are opportunities if we're seeing something extraordinary in our community to apply for funding to address that. That's always existed, where the ministry understands sometimes we need to mount a response greater than we have the resources. to do. We have to pay people to do that. We need the resources. So those mechanisms will continue to exist. And it isn't easy. I just want to acknowledge, I talk about this change, it's people who have been with us, who've been doing all this work. I want to thank them for this COVID response over 3 years. And fortunately, we are able to keep some people on a casual list where, again, if a surge capacity and response is needed, we're able to ask people to come and support us again. Some of these strategies are in place.
Great. And of course, they've done an excellent job. So we just have to see how the needs are out there. Thank you.
Thank you, Member Kavanagh. Member Brown-Shreves, please.
Thank you for the presentation. Just a follow-up question on the salaries, wages and benefits. So are these direct service providers that are being cut, or are there some administrative roles that have been impacted as well?
Are you asking about, sir, the staff cut because of COVID wrap up?
Correct.
Yeah. So the temporary staff who used to support the COVID-19 program, we had been demobilizing them since beginning of 2023 in different phases. And we are demobilizing the remaining staff, like 2/3 of them actually by December 2023. And 1/3 will remain just to support the wrap up. So that includes frontline staff, administrative staff, all together. Whoever was temporary in temporary contract, but we are not cutting any positions that are required actually to support our mandatory programs.
Thank you, Member Brown-Shreves. Member Banham, please.
Hi, thank you again for this presentation. It was very helpful. Again, it seems like the needs and what we're being asked to cover get greater and greater, and the amount stays the same. I feel like a broken record because it's my 6th year here, and I'm going to call out for the 6th year in a row, there is 0 increase from the province for the Healthy Growth and Development Program. And given the rise of or the decrease in access to primary care, this really is one of the only opportunities that new parents have to see a healthcare provider. And it is an opportunity that spans the ability to check in on mental health, to check in on gender-based violence in the home, to ensure feeding needs are being met for babies. And I just need to call out that the original mission of that program was for every single parent to receive a visit, and it has now been decreased to those with, I believe, at least 4 social determinant indicators to receive a visit. And so, again, I'd like to highlight that that program is, I think, receiving 0 increases and has not received an increase since 2012. I believe we sent a letter encouraging increases recently. And so while we are not getting into the weeds today, I'd like to bring that up as a high level piece that is disappointing to see. Again, not Ottawa Public Health's work, but I wanted to bring it up today. So thank you so much.
Well said, Member Banham. I don't see any other hands. So yeah, I just want to again thank Kibri and your team for your work. We were certainly, we would have been in a much different situation had the province not reverted the funding formula back to the 75-25. So that was a positive update. But I think as many of us shared today, that the need we are seeing in the community is certainly outpacing the funding. And so I think as a board, we will have more work to do on advocacy in the year ahead. So with that, we are looking to carry the report recommendations. 1, receive and table the 2024 draft operating budget for the Ottawa Board of Health. And 2, direct staff to forward the 2024 draft operating budget for the Ottawa Board of Health to Ottawa City Council on November 8th, 2023, as part of the City Council's tabling of the City of Ottawa 2024 draft operating and capital budget. And, oh, I think that's it. That's it. Great. Is that Carrie? Great. Thank you. Thanks again. Great work. Okay, we will move on now to item 7.4, Ottawa Public Health Update on Ottawa's Overdose Response Strategy. We will have a presentation from staff, and there are delegations signed up to speak. So while we give staff a moment to get up to the podium here, I do want to note that this strategy received input from many partners, including feedback and input from the community. And Dr. Etches, I was wondering if you would like to offer a few opening remarks.
Sure. Thank you, Chair. Yeah, we talked about mental health and substance use health, and specifically overdoses, at our last board meeting in September. And we did hear from community, they were looking for more timely data. They were looking for engagement and ways to be heard in an ongoing basis, and for a strategy that was coordinated, that you could see people were working together towards common goals. We know that this is a complex challenge that we're facing, and it does take many people. And so what you'll see today is really a strategy in progress. It's a commitment to continue in this direction. And certainly community input is one of them. You'll see new data as a community requested, including maps. So that's new, as well as a depiction of this coordinated strategy. So we are here, this is really not OPHs. This is about a collective on behalf of the Overdose Prevention and Response Task Force. You'll also see in the recommendations that we noted communities need more support around the consumption and treatment service sites. Specifically, they're looking for on the ground, resources that can mitigate the harms on the surrounding communities, and also looking for support with the trauma that they are experiencing from what they witness every day. And so that is also behind parts of the recommendations related to growing community access to mental health and substance use health supports. So I think we'll see what comes out of the broader discussion, but certainly this is one point in time, and we'll continue to go forward from here.
Thank you. Good evening, everyone. Thank you for the opportunity to be here with you and presenting on this work. My name is Benjamin Lakin. I'm the manager of our Community Health and Wellness branch. With me today, I have Kira Mandrick, the program manager of our Harm Reduction and Sexual Health Services unit, as well Eric Leclerc, program manager of our Communications unit. Beside Eric, we have Christina Smith, nursing project officer with Community Health and Wellness branch, and lastly, Cameron McDermott, senior epidemiologist at Ottawa Public Health. Next slide. Thanks. For today's presentation, we will be providing an update on Ottawa's overdose response strategy. This has been developed and will be implemented by a network of partners. The new Stop Overdose Ottawa webpage, the most recent update to the mental health, addiction, and substance use health dashboard, and lastly, the newly launched overdose overview tool. Next slide, please. Thanks. The overdose crisis continues to have devastating impacts and cause significant harms on communities and families across Canada. This has been impacted by the increasingly toxic and unpredictable and unregulated drug supply. And Ottawa, like many Canadian cities, has seen a significant increase in the harms of overdoses since the start of the pandemic. And unfortunately, these rates have remained elevated. The public health role to address the overdose crisis is multifaceted. Key aspects of this role include prevention of harms by providing services that foster positive early childhood development through our Healthy Growth and Development team, prevention work that fosters resilient communities through working with community partners on training, on mobilization, on naloxone, and much more. Our stigma reduction work occurs through many channels, again, working with partners, working on prevention activities through that stigma work, and working on community outreach. Another aspect is our harm reduction work, which includes direct services for people who use drugs, as well as coordinating the Ontario naloxone program. Another important aspect of our work is coordination and convening of partners, such as the work through the Overdose Prevention and Response Task Force, providing timely access to information, communications, and alerts about emerging trends and issues. And lastly, another important role for public health is providing surveillance data to inform system-level planning, policy, and research to enhance and inform actions. I'd like to now pass the presentation to my colleague Kira, who will discuss collaborative efforts of our many partners involved in Ottawa's overdose response strategy work. Kira.
Thanks, Ben. So we would like to introduce a visual of the proposed framework for Ottawa's updated overdose response strategy this evening. You can see it up on the slides here. This proposed update has been developed, as mentioned, with the Overdose Prevention and Response Task Force, as well as Ottawa Community Action Plan members and other key partners. The plan will be further established through ongoing consultations over the coming months as we capture a more fulsome list of ongoing actions and emerging priorities to address gaps and opportunities in our community. You will notice that a public health approach to substance use is foundational to the updated strategy. This includes guiding principles for the respect and inclusion of leadership and expertise of people with lived and living experience, having both a decolonial and anti-oppression lens, utilizing a health and human rights framework, and recognition that substance use exists on a spectrum. Reflected above, the proposed strategy includes access to safe, supportive, and affordable housing as an overarching protective factor and fundamental component required for success. The updated 7 pillars are based on evidence and consultation with our partners on what needs to be included as the main components making up the overdose strategy. An overview of some of the key activities under each of these areas is attached as an appendix to the Board of Health report. This is an evergreen table, and we will continue to work with partners to update and add to this table as part of the strategy work. I want to provide you with a few examples now. Prevention across the lifespan is a crucial component of the strategy, providing interventions that focus on early childhood, fostering resiliency, and promoting mental health and substance use health. This includes work of the Healthy Growth and Development team at OPH working to support new families. It also includes work of our partners such as Project STEP, where Readerwood Addiction Services and LeCap are providing addiction counseling supports and workshops in schools, as well as campaigns and workshops in the community. Reducing stigma. We unfortunately know that stigma continues to be a major barrier for people when reaching out for support. We can reduce barriers and improve care by addressing stigma and discrimination. This vital work continues at both an individual and societal level by partners such as the Community Addictions Peer Support Association. Harm reduction. Interventions involve expanding access to life-saving services in response to an increasingly toxic, unregulated drug supply. This includes continuing to look at how we support people with overdose prevention services like supervised consumption, drug checking, and take-home naloxone throughout the entire city of Ottawa. The coordinated access to treatment and services pillar speaks to improving access and care across the mental health, addictions, substance use health, and social services sector, including culturally appropriate care. We are fortunate in Ottawa to have Access MHA and One Call, One Click, whose expert staff directly match people with trained mental health, addictions, and substance use health professionals. This work also includes innovative practices like the Paramedic Mental Wellbeing Response Team. Community safety and well-being. Here we focus on furthering efforts to improve the safety and well-being of all people who live, work, play, and visit Ottawa. We are appreciative of our partners in the Community and Social Services Department that oversee Ottawa's Community Safety and Wellbeing Plan. Their work is integral to this overdose response strategy. An important example of this plan includes the alternate crisis response team currently in development. I'm now going to pass the presentation over to the rest of the team tonight, who will speak to the final 2 pillars, data and surveillance, and our cluster and response strategy.
Donc, bonsoir. There's no arguing that this is a very complex problem with no easy solution. There are many partners and community groups that are involved in addressing the countless needs in our community, resulting in an abundance of information circulating in our community. As such, we needed to find a solution to get the most accurate and relevant information to those who needed it most. That is the caregivers, the health professionals, parents, and people with lived and living experience. We set out to improve and redesign the stopoverdose.ca website, which was originally created in 2017 in collaboration with community partners. Our purpose? To establish a centralized, credible space to easily share important information about prevention, education, treatment, and covering topics ranging from harm reduction services to how to reverse an overdose using naloxone. We included statistics on drug use and resources available in the community, and so on. The site includes sections that address the needs of various audiences, such as parents, youths, and professionals. Bref, ce nouveau site vise à mieux rencontrer les besoins courants de la communauté. So what did we do to improve this important centralized resource? Qu'avons-nous fait pour améliorer cet espace virtuel? First, we improved the user experience. We did that by making navigation easier and more intuitive. One example is our new menu bar, which is replicated throughout the pages. This menu bar will always be there at the top, allowing for quick travel to any area of your choice, no matter where you are within the site. Nous avons aussi retravaillé les couleurs et simplifié l'architecture du site, and we made it more mobile friendly. This site also includes information about the ongoing work being done to address the overdose crisis. We included information and a link to navigate to Ottawa's overdose prevention strategy and to various resources available in the community. We added a new section that includes some common myths about mental health and addictions. Et nous allons modifier cette liste au besoin. We will be adding a section that points to our modernized Ottawa overdose response and alert system. This alert system, as referenced by Ben earlier, will allow community partners and residents to sign up to receive alerts and warnings about urgent overdose-related issues, including toxicity in the unregulated local drug supply. So lastly, here we have a link to the recently released Mental Health Addictions and Substance Use Community Dashboard. We added a new feature on the website that actually has a snapshot of overdose-specific data, and importantly, a link out to the new and more comprehensive Ottawa Overdose Overview Dashboard. This new dashboard will be presented by my colleague Cam later in the presentation. Maintenant, j'aimerais céder la parole à ma chère collègue Christina Smith. Christina is Nursing Project Officer on the Wellness and Harm Reduction team. Christina?
Thank you, Eric. The Mental Health, Addictions, and Substance Use Health Community Dashboard was born out of the recommendations from the Ottawa Community Action Plan Summit in 2019, which was a comprehensive look at mental health, addictions, and substance use health in Ottawa with a focus on opioids. The Ottawa Community Action Plan provided an early framework for Ottawa's overdose response strategy. The dashboard is the result of a multi-year collaboration between Ottawa Community Action Plan Steering Committee partners, people with lived and living experience, and many other key community partners, including the Overdose Prevention and Response Task Force. The goal of the dashboard is to improve the health status of people living in Ottawa by providing data that will inform and impact planning and interventions. The visual on the slide explains how the dashboard is framed. The three areas in the leaves of the tree provide data that directly relates to mental health, addictions, and substance use health, while the final section in the roots of the tree provide data on root causes of poor health. The dashboard was first launched in April of this year, with the first two areas, Are People Well and Are People Free from Stigma? The sections that are available as of today are, Can people access treatment and services? And do people live with opportunity and equality? As well as updates to the previous sections. The visuals that we're sharing now provide you with an overview of some of the data found in the dashboard. So for example, we know that most people report having excellent or very good mental health, and we saw improvements in self-reported mental health in 2021 compared to 2020. However, self-reported mental health has worsened compared to pre-pandemic data, as well as we know this from feedback from service providers and community partners. We also know that there has been an increase in opioid-related deaths compared to pre-pandemic reports. We learned from the stigma section that almost 100% of people believe that a mental health condition can affect anyone, and that someone with a substance use disorder is deserving of health care. However, less than half of people said they would hire someone with a substance use disorder. The data shows us that someone will wait over 1,000 days for supportive housing, and that double the number of people living in Ottawa reached out for support to system navigators for mental health addictions and substance use health needs. As mentioned, the Do People Live with Opportunity and Equality section provides data on root causes of poor health. In this section, data is shared on topics such as early childhood development, people's experiences with homelessness, community connections, belonging, and more. From this data, we know that there is a decrease in youth that feel like they are part of their school community, especially those that are socioeconomically disadvantaged. The dashboard provides a fulsome picture of the mental health addictions and substance use health needs in Ottawa. This was the ask of community partners to have readily available data that provides this full picture. Over a year of consultation and discussion with partners was conducted to ensure that OPH understood the needs of the community and what data was also available. More recently, concerns were flagged that a targeted overview of the data as it relates to the overdose crisis is also needed. As such, OPH has created the overdose overview tool that provides timely access to data. So I will now pass the presentation over to Cam to give you more information.
Thanks, Christina. So what I'm going to talk about now is this overdose overview tool, which is enhanced overdose reporting, bring a lot of new elements in and to provide the most recent data as a complement more so to the mental health and substance use health dashboard, and address some of the recommendations that came in September with a motion to the board. It's building on business intelligence tools we have, as well as new data sources. Next slide, please. As we go into this, it's really important to remember that while we're presenting a lot of numbers, these numbers represent people. And because most of the data you'll see is an interface between an individual and some aspect of the health system, it's really an underestimate of the true burden of health represented by substance use, and particularly the opioid crisis in Ottawa. It also focuses mostly on the individuals directly affected. So we don't have a lot of data on other people, families, friends. We also don't have a lot of data on the impacts more generally in the community, as Dr. Virech has alluded to in her opening remarks. But what we're seeing here is the most recent data we have, again, with respect to the motion in September, to try to provide the most current data possible. On your reading left, suspected drug overdose ED visits in Ottawa by week. And on your reading right, the suspected drug overdose deaths in Ottawa by week of death. And both of these data sources are suspected because the more current data you have, often the less precise it is here. So the ED visits is based on triage at chief complaint, for example. It's not based on the actual diagnosis that somebody might receive at the end of their emergency department visit. The suspected drug overdose deaths is based on the coroner's first impression of the scene and may not subsequently be determined to be an overdose. However, both of these things still give us useful signals to try to see what's happening in our community. Next slide, please. So here we're taking a step back, and you'll notice right away that we're talking about confirmed overdoses, in this case, opioid overdoses. And the top, confirmed opioid overdose ED visits by month, and on the bottom, the confirmed opioid-related deaths among Ottawa residents by quarter. This 95th percentile line that you see is a threshold of sorts. While the numbers we're seeing by and large aren't acceptable by many standards, that is sort of a threshold where we might be looking at something being particularly unusual. So you'll see on the top graph, July of 2023, the emergency department visits for confirmed opioid deaths was very high, and in fact is the highest we've seen since the start of surveillance in 2017. Similarly, for the confirmed opioid-related deaths, you're seeing the first quarter of 2023 amongst the two highest, again, since the start of surveillance in 2017. So this is not a problem that's going away. In fact, there's a lot of indications in this data that things are getting somewhat worse. When we're talking about where these things happen in Ottawa, next slide, please. We have two different ways we can look at this. Again, sort of keeping with the same information sources. When we're looking at confirmed drug overdose emergency department visits on your reading left, this is by the ONS or Ottawa Neighborhood Study neighborhood of the patient. So it's based on place of residence. On your reading right, again with the suspected drug overdose deaths, we're looking at it by forward sortation area, which is the first 3 characters of a postal code. And we're working on getting more specific data than this. Unfortunately, it sounds like we'll be able to get it in the next couple of weeks. But in both of these measures, we're seeing a preponderance of these harms in the downtown core, in or around the downtown, whether it's based on place of residence or in the case of fatalities, whether it's based on the location of the actual incident of the person's death. So this gives us some idea of what's happening in Ottawa. And while no area of Ottawa is immune from any of these effects, we're still seeing the majority of the burden in the downtown core. I'd like to turn it back to Ben for some closing remarks.
Thank you, Cam. All of the partners on the slide above have contributed to the updated overdose response strategy and the recommendations within the report. These partners have and will continue to lead much of the work within the Ottawa overdose strategy. We want to take this opportunity to thank these partners for their efforts to respond to the overdose crisis and continue to work together to reduce harms and prevent deaths. It's very, very heavy work, and we wanted to take a moment to acknowledge that and to share our collective thanks for this tireless effort. The Overdose Task Force and Ottawa Public Health will continue to work with and collaborate with community, resident associations, business leaders, business community. We know that we need to work together on this. Community resident associations who have been heavily impacted by this, we continue to work with them and will continue to work with them, such as Action Sandy Hill, Lower Town Community Association, and many more. We know that in order to better support community safety and well-being, we need to continue to work together. Working together also includes working with all levels of government and working with all the partners listed today. And we again want to thank everybody involved in this work. This is difficult work, and together we can hopefully continue to advance this and make a difference in our community. Thank you very much, everyone.
Thank you to the entire team. I hope everyone will have a chance to sort of poke around the website. You saw a small snapshot of it here today, but I can tell you it's incredibly comprehensive. It provides context alongside the data. And I know that you're continuing to feed into that and increase the data and the information there and ensure that it's timely. So a huge effort by the team, and really in response to community feedback that we heard not only at the last Board of Health meeting, but throughout. So huge kudos. We do have a number of delegations on this item. Or did we want to go to questions to? Okay. So we have a technical amendment, then we have delegations, and then we will do questions to staff. So Member Gower, please.
Whereas the Mental Health Addictions and Substance Use Health Dashboard infographics distributed to members of the Board of Health and posted on the ottawa.ca and ottawapublichealth.ca with the report titled Ottawa Public Health Update on Ottawa's Overdose Response Strategy as supporting document 3. English and French inadvertently contain the following errors. Maybe I'll just skip to the therefore be it resolved, since it is correcting. Yeah, it's on the screen there. Therefore be it resolved that the Board of Health for the City of Ottawa Health Unit approve the report as amended by the revised and updated Mental Health Addictions and Substance Youth Health Dashboard infographics, and authorize the Board of Health Secretary to post the revised and updated Mental Health Addictions and Substance Use Health Dashboard infographics in English and French on ottawa.ca and ottawapublichealth.ca as supplementary supporting documents to the report.
Thank you, Member Gower. We did just lose the screens in the room. Is it okay online? Still see? Yeah. Okay. We can go to the first delegation. We're just going to try and get the screens back up because some delegations do have PowerPoint presentations. But first delegation, Dr. Alexander Codarella, I believe, joining us in person. Great. Thank you, Doctor. You have 5 minutes. Please go ahead.
Well, thank you so much for having me. I'm Alex Cautarella. I'm a family physician and an addiction medicine provider, as well as the CEO of the Canadian Centre on Substance Use and Addiction, which, although we're a national arm's length agency that provides advice to governments, we are located just down the street. So I was able to walk here from my office. We're a very proud partner of Ottawa Public Health and been very fortunate to meet very frequently with their staff to better understand, I think, many of the issues that are taking place in the city. So and more than anything, I just wanted to provide a little bit of context under which I think both this overdose response plan and other things can be experienced. So one of the most important pieces is that although the COVID pandemic is waning, we really, from a substance use point of view and substance use health point of view, have not come out unscathed. Our own data demonstrates that there's a 20% increase in costs and harms related to substance use across the country. In Canada right now, that's a figure that's roughly $40 billion per year. And about half of that is lost productivity, people pulled out of the workforce. A good chunk of that is healthcare costs. And as we know, our healthcare system is crushed and already at its breaking point. So this is a significant burden there. One of the questions that frequently comes up is to what degree are problems, for example, in certain areas caused by or changed, I think, by different services. And one of the pieces that I want to be able to contribute to is to tell you that I'm very privileged to be able to speak to people across the country. And unfortunately, this is something, as the colleagues from OPH spoke about, is something that's seen over and over again in every city. It really has a lot more to do with poverty, the toxic drugs, and in particular, the synthetic drugs that are being utilized. So fentanyl, methamphetamines, so these synthetic stimulants are really leading to a change, both in utilization patterns, but also I think it's broader impact on not only the people who use drugs, but the people around them. There can be very frequently temptations to look and to wonder about, is it best to have services? Where should they be? Should they be moved? And I can tell you, I get asked this a lot. The literature has been quite clear. People don't like to travel very far for their services. I mean, no one really does, but especially when it comes to things that are a little bit more inconvenient and when people are feeling rather urgent to use drugs. So for the most part, we know that people aren't really being driven towards particular locations by services, but rather the other way. They're there, and really they're not going away. And although that hasn't been the focus of the discussion, I can tell you across the country, there's a lot of questions about, should we move services? Should we change services? Should we close services down? And there really is nothing in the academic literature to point to the fact or any expectation that anything would get better in a particular area if that were to be done. In fact, because those folks are there, the evidence really does point to the fact that situations would more likely than not get worse. It doesn't mean that we need to be dismissive of concerns around especially community safety. I think these concerns are very real. I think we need to recognize that especially this time is not a time of comfort. It's a time where people are feeling increasingly unsafe. Again, not just in Ottawa, but in cities across the country. But I actually think that there's some really good solutions. I think OPH touched on some of them. I think we're at this moment, like it's a big moment of national need, and it's a moment of public health need as well. I think that in order to best understand what we can do, and really the literature does point towards a full spectrum that's necessary. And I think we heard about that a lot in the presentation. We know that treatment rates in Ontario and in the country are painfully low when it comes to the gold standard treatments. For example, opioid agonist treatment. We know that in many areas it hovers at about a third of people who should be receiving that kind of treatment. High-risk individuals are actually receiving. We know that supervised consumption sites and other harm reduction measures are hard to access, but also have been around now since 1986. Is that my time? Or okay, I'm gonna take just 10 more seconds. And I'm just going to say that this full spectrum goes a long way. I will quickly say that I was looking up the Ottawa Charter is going to celebrate its 37th anniversary next week. And I just want to pull two quick things from that. Just to say that right now, I really think that we find ourselves at a crossroads. We can embrace fear and I think discomfort, or we can look at as communities and really come together. So one of the most important things in public health is a reminder that all solutions need to be local. And this is why I'm so glad that there's this kind of engagement in these kinds of processes, because we know that every solution needs to be local. And two things that came out of this Ottawa Charter this time when 37 years ago, people from across the world came to Ottawa to have the first conference on health promotion. They talked about the necessity of two things, which was to create a supportive environment and to strengthen community action. And I think Ottawa can do very well by helping people understand that everyone has a role to play in making this better, especially around, and I'm really glad to see prevention be a very significant element. We're now in the 8th year of a toxic drug crisis. The people who were dying, well, they were 12 or 13 at the time that this started. So I think a full spectrum and evidence-based methodology is important. And I think this fits, unfortunately, into the larger landscape we're seeing across the country. Thank you.
Thank you very much for your delegation, Dr. Cottarella, and thank you for the work you're doing nationally on this issue. We really appreciate you coming to talk to us today. Do we have any questions for the delegation? Seeing none, so thank you very much. Go to our next delegation, Chief Pierre Poirier.
I have a timer with me. Bonsoir, la présidente. Good evening, Chair. Pierre Poirier, I'm the Chief of the Ottawa Paramedic Service, and thank you for the opportunity to speak today. Quand je pense à nos défis comme le service paramédic, puis aussi la santé publique, il y a trois affaires que je pense. C'est les soins, la collectivité, puis la collaboration. So there's three real kind of challenges that we all experience that we share with public health. It's providing the care, our community, and our collaboration. So a few of my notes will just kind of relate back to that. We've been working with public health, and kudos to Andrew Hendricks, Ben Lykin, and others who have been very supportive of activities that we've engaged in. With respect to naloxone, in 2022, paramedics administered about just over 320 times. And in the first 10 months of this year, we're up over 450. So we can say that it's, at least a 50% increase, which is really quite significant. And there's a certain amount of sadness in that. We've been working with public health also to provide our data. And we're working on cleaning it up as well. Because what often happens with paramedics is we arrive on scene and the naloxone's already been given, or multiple doses have been given. And sometimes we do add to that. Other times we may not. In terms of what's really kind of important here is that, going back to 2021, I think it was Andrew Hendricks, when we first started talking about giving out naloxone kits, he said, just do it. And that's what we did. And part of being sensitive to stigma, we didn't record any of it. There was a real challenge for us internally to say that, but the whole idea was just get the kits out there and let's help people. We haven't really just been tracking the distribution other than the fact that we probably, the year to date, we've probably given out over 500 kits. And that's just paramedics on scene saying, hey, do you want a kit? Here's a kit. No questions asked. In March of 2022, we started the mental health response team, well-being response team, and once again, support for public health. And this team combines a paramedic with a healthcare provider, a social worker from the mobile crisis team from the Ottawa Hospital. You know, you have a dream. If you build it, they will come, and bit by bit, that's what's happened. And you know, it's really hard to extricate mental health from substance use and addictions. And really, we don't. We just take it at face value and we provide the service as we go along. The reason I mentioned the mental well-being response team is that when we've taken a look at those individuals to whom we provided Narcan or naloxone, we noticed that a lot of them are return visits. And when you think about it in the broader picture of providing care, naloxone is a temporizing measure. And if anything, it steals somebody's high. And immediately afterwards, what are they looking for? So I think the previous speaker spoke about agonist-antagonist therapy. So we're at the point now, hopefully by February next year, and the team always kind of shivers when I say when, we'll be providing Suboxone as a temporizing measure with a 24-hour follow-up, also in concert with the Royal and their RAM clinic. And I have to make sure I look at the acronym, the Rapid Access Addictions Medicine through the Royal. So what we're trying to do is go to that next step. It's not just providing the care as a temporary measure, but going to the next thing to help bridge people, to bridge these individuals to treatment. And I think that really is an important piece. So without getting further, I think there's one other important point, and I think Councillor Gower's absolutely been involved in it, is the paramedic community has been committed to the Ottawa West Four Rivers health team and the clinic that's being proposed in West Ottawa, which would have a mental health component to it. Once again, we don't differentiate mental health from addictions or for substance use. And an important piece there is that we're committing to have a staff member to actually be a participant there on a regular basis. So I think that really is an important piece for us in our contribution to our community. Thank you for the chance to speak, Chair.
Thank you for being here, Chief. Your timer's a little bit quicker than ours.
I put 15 seconds of lead time there.
Do you have any questions? Seeing none, thank you very much. Our next speaker, Dr. Kim Koras.
Hi there. It's a pleasure to be here, and thank you for including me. And it's a delight to be here with and talk about some of the systems and strategies that we've put in place alongside and in partnership with Ottawa Public Health, or many other colleagues who are here today, partners across the system, and most importantly, people with lived expertise. I'm just going to let folks know when to advance my slides, if that's okay. So next slide. Central to the strategy report that you saw was the importance of regional coordinated access and getting care to people when and where they need the care. We know that our system of care in mental health, substance use, health, and addictions is confusing and complex. It's hard for clients, family members, loved ones, and supporters in primary care to actually navigate how to get people access to care. So together, as a community, in partnership with OPH and in response to the Ottawa Community Action Plan, as well as many of the public health strategies, we developed a digitally enabled regional coordinated access service so that people have an easy way to get access to mental health, substance use, health, and addiction support when and where they need them. Very simple, as basically 1, 2, 3, you can go to accessmha.ca and check out the website yourself. But clients just need to identify that they have a need for help. Access MHA gives a single door into the system, no matter where a client lives or what they need. Through standardized processes and tools, we match people to the appropriate level of care, providing support while people wait. And of course, including peer support in that. It's about a 24 to 48 hour wait from when a client reaches out to help or a primary care provider reaches out to help to when we're able to have an Access MHA team or staff member reach out to that person. Go to the next slide. This actually we have a lot of evidence, which I won't show you, obviously, in the 3 minutes and 30 seconds that I have left, that actually can demonstrate how Access MHA has helped us achieve our mandate to improve access to care, provide system and service integration, ensure that health equity is everything that we do is grounded in health equity in our approach, and really supporting evidence-based system transformation. And of course, all of our work is not just co-designed, but co-led by persons with lived expertise, ensuring everything that is created is by people with lived expertise for people with lived expertise. Next slide. We have served nearly 22,000 individuals. That's close to 40,000 direct contacts with clients. This information actually feeds into the dashboard that you just saw from on the public health website. Main problem areas that people present with are depression, anxiety, and substance use health and addictions. And when you just heard from our chief of paramedics, he mentioned it's hard to differentiate sometimes because people present with both. And we could say, yes, from our data of the tens of thousands of people coming to us, close to 60% of individuals do struggle with multiple problem areas. Nearly 20% of individuals are from our priority populations based on ethnic background. Nearly 10% identify as francophone, and almost 20% identify as having a disability. And those are really important things for us to track in terms of our equity metrics. Next slide. In terms of how Access MHA helps increase access to care, you can see here that nearly 50% of individuals, when asked if Access MHA didn't exist, had reported that they would not have accessed the appropriate care. Nearly about 25% wouldn't have accessed any services. Nearly 15% would have went to the ED, and 14% just would have, went to the internet, talked to family and friends, etc. Through Access MHA, we've been able to connect people to appropriate access to care. And in fact, 93% of all people served are matched to a service that meets their needs and preferences. And the majority of people report being satisfied with respect to Access MHA. Next slide. You heard the chief just talk about RAM clinics, which are rapid access addiction medicine clinics. And our RAM clinic at the Royal is in partnership with many providers in this region, including paramedics. And we are low barrier walk-in clinics that give rapid access to evidence-based care for individuals with substance use health problems. We have extensive research, including CIHR funded, grant funded research demonstrating how RAM clinics increase access to care, reduce alcohol and opioid emergency department visits, reduce opioid hospitalizations and deaths, have high levels of client satisfaction, and actually save millions and millions of dollars based on our economic evaluations each and every year in Ontario. Next slide. I'm not going to get in too much into this, but just so that you see RAM clinics, although the actual service is based at the Royal, this service is provided in conjunction with many partners, public health, hospital and emergency departments, primary care, paramedic service, community programs, and of course, Access MHA to make sure people are always connected either to RAM clinics if they need that service through Access MHA or to other services in the community post their care at our RAM clinic. Next slide. We developed a digital front door to make it even easier for people to access care. We piloted this at the Royal, and now it's in 20 other clinics in Ontario and in other provinces as well. And all individuals have to do is really go to the royal.accessram.ca, and they can be immediately connected to our virtual RAM clinic. It recreates a virtual walk-in clinic, virtual waiting room, makes team-based care possible. And if you go to the next slide, you can see individuals actually are connected on average within 3 minutes of connecting into our digital front door and see their first clinician within 9 minutes of entering the digital front door. Through our partnership, we've had almost 35,000 virtual visits through the RAM digital front door with very high levels of client satisfaction, about 95%. We've been able to increase access to francophone services and better serve our rural community and expand our reach so that no matter where an individual is, they can get connected to the rapid access addiction medicine and life-saving care that we provide. Next slide. And I think I'm exactly at 5 minutes. So unless there are any questions.
Well done.
Well, I tried.
Appreciate that 5 minutes goes by quickly when you're trying to speak about such a complex issue. So thank you. Not seeing any hands up. I just wanted to, a lot of important data in your presentation, but wanted to underscore almost half would not have access to care. So thank you for the innovations you're making.
Well, and thanks to you guys at OPH too for helping us to get this out there and get the communication out there. It's one thing to have a service that can help people, but then the other piece is making sure people access the services that are available, right? So thank you.
Absolutely. We have a rock star communications team here at OPH. So thank you for being here. Appreciate it.
Thanks, Kat.
We will go to our next delegation, Dr. Ian Coleman, please.
Hi, so I'm Ian Coleman. I'm a professor from the School of Epidemiology and Public Health at the University of Ottawa, and I am determined to beat the buzzer. So I will be brief. I think it's pretty clear that the new mental health addictions and substance use dashboard from OPH can be really informative for service provision, but I just want to talk a bit about how it can also inspire research. So this is a research question that my team had very recently, and that was whether racialized groups are less likely to perceive a need for help or to seek treatment when they are thinking about suicide. So we've got a student who's working on this. We got a small grant to support community partnership, because we know that partnering with people with lived experience or experience in service provision makes the research better. But the question is, how can we best recruit partners? Dr. Cottarella said that all solutions are local, and I would argue that maybe all motivation is local as well. And I think it's a lot easier to get people engaged in research if we can show them local data that is relevant to them. So I'm just going to give you a couple quick examples from the dashboard. So I just start here with life satisfaction by subgroup, and this is comparing non-racialized to racialized groups, and it doesn't look like there's a lot of differences there. And if we look at self-reported mental health, so people saying that their mental health is excellent or very good, again, not a lot of difference. The confidence intervals are very wide. Maybe racialized groups were doing a little worse at the beginning of the pandemic, but maybe doing a little bit better a year in. But interestingly, here it looks like racialized individuals are more likely to say that they want mental health support, but don't know where to turn. So that's something that might raise some eyebrows and get people really interested in further research on this topic. Similarly, if we look at younger people, we see very few differences in terms of self-reported mental health between racialized and non-racialized groups. And the younger people, actually, they are very similar with regards to whether they want mental health support and don't know where to turn between racialized and non-racialized. But what's very interesting is that the racialized groups are much less likely to say that they saw a doctor, nurse, or counselor about their mental health in the past year. Now, that could be, this was alluded to earlier, that they don't have a regular healthcare provider. And again, I'll just point out that, these have wide confidence intervals, but this is just a starting point for research, or there could be other reasons. So again, this is straight from the dashboard. People of color, these are some of the barriers that they report to accessing mental health support. So it could be logistical things like distance to service or availability of service, or it could be bigger barriers like cost of services or stigma. So again, this is a starting point from which we can do much more in-depth research that might actually make a difference in the community. So I would argue that using local data to inspire research instigates relevant research questions. It motivates researchers to work with community partners. It engages community partners, which enriches the research process and the quality of the research. It makes it more likely that research will influence policy or programming, and it helps draw a more direct line from research to benefit for the community. And I haven't heard the timer yet. And I will say thank you, and I apologize for bringing humor to such an esteemed place, but I'm a professor and I have to do it. Thanks very much.
Thank you very much, Doctor. You beat the buzzer, so congratulations. Not seeing any hands, so thank you very much for being here. Appreciate it.
Thank you very much for your attention.
Next delegation is Jose Blackburn, please. We're just going to get your presentation set up on the screen, Jose.
Thank you very much. And it doesn't look like I can start my video. If you wish to allow me, I think you just did that, maybe.
Yeah, you should have the permissions to. There we go.
There we go. Thank you. Well, thank you for having me and giving me an opportunity to highlight what this might look like from a child, youth, and family perspective. And to start, I just wanted to point out a little bit, since we're newer in this environment, Kids Come First is a health team that brings together many partners across the region. And Kids Come First really has been put in place to work closely with OHTs, but also to look at innovative ways to bring new programs and services to children, youth, and their families. And as you will see on the next slide, we have over 60 partners, thousands of physicians, and many other individuals that participate in the health team. And at the core of it is our children, youth, and their families as equal partners to the work that we do. So I wanted to tell you a little bit about Kids Come First. And from the very beginning, on the next slide, you will see that a focus area in a priority population has been around mental health, addiction, and substance use health. And we have a planning table that has been looking at some of these complex problems together with the many partners across the region. And I've listed a number of those initiatives, projects that the team has been working on to really support mental health, addiction, and substance use health care across our region in the city of Ottawa. And some of it you've heard from my colleagues around the regional coordinated access for children and youth. We have some nurses in the school, and really some of you have touched on that around the infant and early childhood mental health and the importance really around the prevention and early intervention. We talked about the dashboard and some of our data that feeds into the dashboard and some of the collaboration around the hospital and the community. And I think, I wanted to share that some of those projects and in fact some of those recommendations came after a young people did die of an overdose. So I think it's important for us to recognize that behind these initiatives, we have young people and their families, and we have the loved ones that have been touched by tragic loss around this crisis. On the next slide, I wanted to bring a little bit of focus on the regional coordinated access. So similar to my colleague, Dr. Karas, that just presented Access MHA, we work closely together to provide coordinated access to children, youth, and their families. As simply as one number to call and one link to click, access to virtual services. Again, similarly to the Access MHA model, services to matching and navigation support to the right care, and we provide some hands-on care coordination for complex situations. Another key component for children and youth, as we heard really clearly from our families, is the peer support for those families themselves and the loved ones around families. So we believe that we've seen over 10,000 kids in the last couple of years come through this new program, and there are really able to work with our partners that you will see on the next slide to match them to the right services. This picture to me, as I call it, my flower, it's a flower.
I apologize. We have to have a motion to go past 7 o'clock. So we've paused your time. If you can just pause, I'm so sorry to do that. Member Gower.
Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
Is that carried? Thank you. My apologies again, just a procedural thing we have to do, and back over to you.
No worries. I think this is just to show a picture that it takes a lot of people to work together on solving these complex issues. And this really represents the collaboration, the strong partnership, the co-design with young people, really the regional data and the evaluation of all the work that we've been doing together. I think representing over 60 partners from a health team, a subset of mental health, addiction, and substance use health, would be amiss to say that, you know, we've done collectively, been able to make some impacts and move the needle in the right direction. And really proud to have Ottawa Public Health as one of those partners. On the next slide, very quickly, wanted to say that the dashboard is really around using data to make decisions and to make decisions based on real-time data. So this data, I will invite you to look at the OPH dashboard, feeds into that dashboard. Next slide. And I invite you to visit our website at One Call, One Click to have a little bit more information. And I think finally, what I want to say is impress upon is that there is a lot of people working together to really improve the well-being, health, mental health, addiction, and substance use health of young people in the city of Ottawa. I'm really proud to work with so many partners, including OPH. Thank you.
Thank you so much. Do we have any questions, delegation? Seeing none, thank you very much, Jose, and apologies again for interrupting you. Okay. We'll go to our next pair of delegations, Jerome and Carol Dutrio, please.
Thank you for giving us the opportunity to speak. I have to say that we're learning a lot this evening and somewhat heartened by the to hear of all the multi-pronged efforts going on, but we still what we offer is perhaps a little snapshot of life in what we experience living in Sandy Hill, and some of our thoughts on the recommendations in terms of community relations. We applaud the overall overdose prevention plan, but there are a few things missing in our view, which relate to some of the basic human needs of the unhoused population that we think, if better fulfilled, would also improve community relations. Our context, our context, in a 2-block radius around our house are a large shelter, the Ottawa Mission, a soup kitchen at St. Joseph's, Sandy Hill Community Health Services, and Center 454 daytime programs and services. A few blocks further north is Lower Town, with another large concentration of services, as you know. In the past 2 years, the number of loiterers around our house has multiplied, and the behavior of those who loiter has deteriorated markedly. We first found that our steps at the front door were becoming a favorite spot for people to sit. They usually moved when requested, but unpleasant and harassing behavior was frequent enough that we lost tenants who felt threatened. We installed a low fence with a gate to discourage access. We find people sleeping or improvising tents in our driveway. We smell urine and find feces near the garage. Recently, the garage was broken into and ransacked. Every day now, people settle to sit with their belongings on our driveway. When we request that they move so that we can enter to park, they usually comply, but their speech, what we notice is the speech is often barely intelligible, confused, and rambling. A ledge at the house wall seems to be a favorite site to sit, inject, and inhale. Last summer, the stench of urine in the driveway was overpowering. The litter that we pick up almost daily includes clothing, t-shirts, pants, undergarments of all kinds strewn on the driveway and street side, a jacket or towel hung on the fence. Fortunately, the needle patrol is fairly consistent in removing needles, but we sweep up the broken glass tubes, pipes, and other drug-related trash. 1 week ago, when we left the house, 2 men were sprawled unconscious, unresponsive, one on the west side driveway, the other to the east on the sidewalk at the church door. A team from Center 454 was checking them and reassured us that they'd be all right. They were then left sprawled on the ground. Last Thursday, a visitor coming to meet with us found a man on the ground unconscious beside our car. She summoned the police and emergency services, and he was removed. We appreciate the help from the Needle Patrol, the community engagement team, and the police. Measures for overdose prevention and safer drug use are visible around us and are commendable. What seems to be forgotten in our view is attention to some of the very basic human needs of those living on the street. Free toilets open to the public day and night, a place to sit and rest, some green space. We wonder if we can't ease some of the misery we see on the streets. I quote from an unhoused man whom I asked to move from our driveway so I could park. I asked him what was so great about our driveway that he had come back several times to settle there. His response: it's quiet, calm, and close to services. What desire could be more reasonable than that? We're glad to see supportive housing as a concern and an overarching goal in the plan, but might the plan in the interim include provision of public toilets, including frequent cleaning and maintenance, more trash bins, also with frequent cleanup, designated tranquil green space and seating with supervision to ensure tranquility? Relations with the surrounding community would definitely improve, and the conditions of life for those awaiting housing. Might your plan also include provisions to reduce the current over-concentration of services in our area, perhaps with smaller service hubs with pleasant surroundings in every neighborhood? On our block, there's a family with children, a childcare facility, 2 nice B&Bs, and a small hotel offering lodging for tourists. I feel for those families and those businesses trying to create a pleasant environment in which to live or to share our beautiful city. Our children.
You are at time if you wanted to just take a few seconds to wrap up.
Okay, thank you. Our children are adamant that we can't remain living in the conditions they currently see on the street as we age and become more frail. We would love to stay, but we must agree that we feel more vulnerable and primarily sad and shocked by the suffering that our city seems unable to alleviate. Thank you.
Thank you very much. We do have a question for you from Member Carr, please.
Yes.
Hi, thank you very much for your delegation tonight. And I certainly appreciate your point of view. I will mention that I owned my first home in Sandy Hill, and I sold it in 2004 and moved to Alta Vista. And recently, I'm also on the police services board. I did a ride along, walk along with police services and Councillor Plant in the area. And I don't often spend a tremendous amount of time walking the streets, but I certainly can say that I noticed a considerable difference in the 2 decades since I've lived on those streets. And I appreciate the challenge that there are. I just wanted to mention, some of the items that you mentioned, service hubs. I mean, I saw that mentioned in the opioids report that we had for public health, some of these suggestions, but many of them I think fall within the scope of different areas of the city within community and social community and community, I can't remember.
And social services, probably.
Yes. Anyway, I'm on the committee, Community Services Committee. And certainly your note about people, wanting a little bit of space, wanting a place to congregate and using driveways. I think you said it yourself. I think supportive housing is really, really, really the way that we need to go. And I think we have 166 units or something like that under construction presently, with more on the way. And I certainly appreciate, I just wanted to reassure you, I know that we have a council members, and I'm looking directly across some of my wonderful colleagues. I know that we have a council that's very dedicated to making that happen, but I just wanted to thank you for coming out tonight.
Thank you.
Thank you, Member Carr. I'm not seeing any other hands, but I did just want to echo Member Carr's comments. Thank you very much for coming and delegating. We certainly appreciate your perspective and your feedback in regards to community safety. So thank you for being here today.
Thank you.
Our next delegation, Conseil Plante, we're just putting your presentation up on the screen. So just give us one moment.
Est-ce que vous m'entendez?
Oui.
Okay, merci. Hi, everyone. Bonsoir tout le monde. So this, hopefully I won't go past the 5 minutes, but it's just, this is a presentation talking about sort of what's happening in my ward in conjunction with the overdose response strategy report. Next slide. So if you'll just indulge me for a minute, I encourage everybody to go and read the Supreme Court decision on Insight, which was released in 2011. Insight, as we know, is the first sort of sanctioned safe injection site in Vancouver. And the last couple paragraphs, they're not all cited there, but the court sort of talks about sort of the community impacts of injection sites and cautions policymakers that where you put them will have impacts on the community, and communities need resources to support them, or there could be some sort of blowback against the concept of harm reduction. Next slide. So I'm not here to challenge the policy imperatives of harm reduction. I do, however, want to speak to the redlining of services in Ward 12. And I fear that what Justice McLaughlin, as she then was, cautioned in her decision in 2011 is now happening in 2023, where we see that a lot of governments, states, and municipalities are rolling back services in response to community concerns. Next slide. So you guys talked about on page 3 what you called adverse childhood events. And I do want to sort of give you a snapshot of what it's like for a lot of children in Ward 12 presently. Next slide. This is called the Neighborhood Equity Index. It's done by the Social Planning Council in Ottawa. And obviously what is in red are what are considered very low income neighborhoods for children. They have a really interesting sort of way they look at what they considered low income neighborhoods for children. They don't just look at income. And I encourage everybody to go on the site. This is kind of an overview of the city of Ottawa. Next slide. So this is my wonderful ward of Ward 12. You can see sort of the dotted lines, the outline of Ward 12, and you can see the majority of it is considered not a great place for children to be raised in. Next slide. So this is just a snapshot. It doesn't include everybody who's involved sort of in the harm reduction or shelter space in Ward 12. The blue dots are shelters. The black stars are what's considered the safer supply pharmacies. Green is injection sites. And I like to point out that this is the largest concentration of services in any ward in Canada. And I have spoken to all of the executive directors or the CEOs of these spaces. And what I thought was interesting was all of them except for one, they live about 30 kilometers from downtown, which shelters them and their families of the consequences of the decisions they make and the positions they take in the community. I also want to point out that the kids in my ward don't have a choice of where they live. I have the highest concentration of Ottawa public housing, as well as children living in motels on both Rideau Street and Montreal Road. Next slide. So this is a snapshot of Lower Town, which is sort of on the northernest side of my ward. I have spent a considerable amount of time in the schools there as well. I did my budget consultations in Lower Town. And John Copeland, who's the principal of York Street Public School, reports that 95% of the kids at York Street Public School live below the poverty line. And 50% of the children at York Street Public School are born outside of Canada. Next slide. So I've now sort of superimposed that previous map with the hearts that show places like parks and daycares and schools. These should ostensibly be safe places for children. But what the parents living around these sites tell me, I've heard anecdotes from everything from last week, for example, children were not allowed to go out at recess at St. Anne's School because there had been 3 overdoses and there was ambulance and other attendants on site. So the kids had to stay inside. And the other one is just parents who will not let their kids have normal childhood experiences like going to parks, going to basketball courts with their friends because they worry about safety in the community. And they also worry that they will be a magnet for, drug dealers and other unsavory characters who tend to congregate and take advantage of the over concentration of services, which you heard the couple prior to me speak about. Next slide. So these are some of the consequences, of course, that happen in my ward. This is obviously very strongly felt by our very youngest residents. And so when I hear things like, you know, what you talked about, you know, this is not in scope of Ottawa Public Health, or this is not something we deal with or in our mandate. I urge you to sort of rethink that, because what we know from the crack epidemic is that, you know, something like the war on drugs had profound effects on the community, and not just on, you know, the people who were involved in drugs at that time. We know that places, we know the impacts that Purdue Pharma had during the OxyContin crisis, of just having this myopic view of the work they do and their role in that crisis. And so I urge you to sort of rethink whenever you say this isn't us, this is not what we do, this is not our lane, because I believe this is everyone's problem and we all have to get involved for solutions. Next slide.
Conseil, you are at time. If you wanted to take a few moments to wrap up.
Yeah, sure. So I'll just sort of talk about this slide here. The one thing I noticed was lacking in your report was a concept of prevention. I do not wish to roll back to the days where we compared our gray matter to breakfast. I don't think that's a wise way of looking at prevention. But we do know, and if any of you went to see the film at the Bytown last week about fentanyl, that it takes just one hit to get hooked. It takes just one time. And I believe we need to do a better job of educating our youth as to the consequences of opioids. And we need to discourage them, much like we do for cigarettes and alcohol, because the long-term consequences are very severe. Thank you very much.
Merci beaucoup, Conseillère Plante. I'm not seeing any hands, so thank you very much for being
Merci
here.
beaucoup.
Appreciate it. Our next delegation is Calla Barnett. Calla, we see you. Oh, there we go.
Hi, sorry about that. I was in and then I was out, but I'm back in now. So, all right, I'll just jump in. Yes, thank you. So thank you for having me. Unfortunately, I'll probably be a little more like, but what about us in my presentation? So I'm the vice chair of Action Sandy Hill. I'm the chair of our Community and Social Services Committee for the community. I'm also the co-lead in coordinating the Sandy Hill Community Liaison Committee alongside the OASIS program and the City of Ottawa's community engagement team. So I'm doing this, and I'm disappointed and frustrated and angry by the report, and I'm going to tell you why. And I don't see anything new. I don't see new ideas in it. I don't see anything innovative in it. So I'm going to position myself a little bit in relation to this, and then I'm going to explain. I'm a white woman in Sandy Hill. Obviously, that comes with some privileges, but I will also not allow anyone to call me a NIMBY or vilify me. That happens to me by service providers and by some people who work for the city. I've been called a NIMBY. I've been called a person who stigmatizes people with substance use disorder because I don't like the way systems are run. But it has nothing to do with people who have substance use disorder. So I have some intersecting identities that matter in this. I'm disabled and I experience chronic pain. I also have an additional medical condition. I'm a single parent. I'm a queer woman. I'm consistently one missed paycheck away from homelessness myself. I don't want pity, but I do want to be taken seriously. I don't want to vilify anyone. And this is a very small piece of a very big and nuanced opinion. I've got 20 years of residency in Sandy Hill. I am academic in political science and human rights. I'm practical expertise in human rights advocacy, defense, and analysis. I have a career as a diversity and equity and inclusion consultant, and I am experienced as a person who has lost family and friends to overdose and health complications from substance use. And I'm also someone who's walked right up to that line. I just managed to walk myself back. So I'm here. I have all this experience and knowledge, and I find your framework for the report problematic. It's not a decolonial lens. If it was decolonial, it would be trying to change the system, not trying to make changes within a system that's already broken, and that is colonial in and of itself. Stop using that word that way. It might be intersectional, but I don't see intersectionality in the report. And you need to define community. Define it for the report and the way it is used in the report, please, because we have been gaslit and told that the community was consulted when in fact it was simply the community of clients that were consulted. Like, I have not been consulted as far as I'm concerned with relation to this report. And I don't know any community member in Sandy Hill that isn't a service user or a client of a service that has been consulted. And I'm accessible. Like, I'm the only Cala Barnett around. You can Google me. So this has been done to gaslight us in the past. I don't know if you're doing it on purpose. I don't know if it's just that same little echo chamber of people doing it again. Former director of Oasis liked to do that to us a lot. So I know he's around still somewhere doing similar things. But he did it for years, and now Sandy Hill is in dire straits. So nobody ever listened to us, and I feel like you're still not listening. I don't know how to continue to be excluded from these conversations and be okay with it. I'd like to draw your attention to comments on page 19. This is why it's important. Page 19, paragraph 3, halfway through the paragraph, it says, community concerns include public urination and defecation, littering, needle disposal issues, public drug use, concerns related to personal safety, so we're going to unpack that, and gaps in day programming and mental health services, obviously, across the whole city, in fact. But I would highlight some concerns related to personal safety. They include unprovoked violence, like my neighbor on Daly Avenue who was randomly punched in the face when she got out of her car by a high person, breaking and entering while we are not home, and while we are home, this looks like somebody knocking on the door and then trying to force their way in when you go to open it and see who's there. That's happened to me, a single disabled parent with my child home. People offering to sell drugs to children, like my 11-year-old. Dropping fentanyl and Dilaudid on the street for our children and toddlers to pick up and put in their mouths, and our dogs. So a person with lived experience showed me where these things were so that I could keep an eye out for my kid. I'd also like to highlight some other.
Cala, you are at time, but if you want to take a few seconds to wrap up.
I'm going to take as much time as the first guy did. So public drug dealing, increased gang activity, these are other concerns that we have. Drug use on private property, threats being yelled at daycares and schools, theft from daycares, theft from private property, loitering on private property, loitering in public spaces and blocking the sidewalk, somebody dying in front of me in 911 dispatch telling me that I need to make sure it's really a problem. Somebody trying to break into my home in 911 dispatch telling me they might just have the wrong address, and human trafficking. So we get to see that right at the corner of Rideau and King Edward. I have so much more to say, but what it boils down to is that this is not dichotomous. This is not harm reduction or abstinence. This is both. We need both. We need to be doing everything. It needs to be all of us, all at the same time, working together. And we can't keep fighting each other. This is not us versus them. And that report sets it up to be dichotomous. It looks dichotomous from where I sit. So please, let us help. Please let us help, because that's all we want to do. We want it to be safe for us. We want it to be safe for businesses. We want it to be safe for people with lived experience who are living the experience, right? We want it to be safe for our kids. We want it to be safe for indirect service providers like the library and the daycare that had to move, and they're not going to be in Sandy Hill anymore. You know, like it's so bad. And please just talk to us.
Thank you.
Thank you
for your delegation. I'm not seeing any hands, but we really appreciate you being here and sharing your perspective. Thank you. Next delegation is Derek Finkel.
Thank you. Chair, can you hear me all right?
Yes, we can. Thank you.
Okay. I've been asked to be here today to address Section 2D of the report recommendations before the board. I've lived across the street from the South Riverdale Community Health Center in the Leslieville neighborhood of Toronto for almost 15 years. The South Riverdale Health Center has had a supervised injection site on the ground floor of its building since 2017. South Riverdale made national headlines this summer after a mother of 2 young children was shot to death during a gunfight between 3 drug dealers outside of its CTS site. It made headlines once again when one of its harm reduction staff was subsequently charged with aiding and abetting one of the alleged shooters. I'm here today as a member of the Leslieville Neighbors for Community Safety and a journalist who has published 15,000 words to date about my neighborhood's very frustrating experiences over the past 5 years to get South Riverdale to address our safety concerns and to provide any accountability whatsoever for its failure to do so. My understanding is that Ottawa Public Health currently has the same extremely limited powers of inspection since 2021 over provincial CTS sites as Toronto Public Health. These inspections, which are arranged in advance, are cursory at best and fall far short of proper monitoring and enforcement, especially when viewed from a community and safety standpoint. I would hope Ottawa Public Health will join its counterpart in Toronto in requesting that the province increase these powers and at bare minimum, allow for unannounced inspections. Outreach workers, as recommended in 2D, to address concerns of neighboring communities are not going to solve the fundamental problem with supervised injection sites, especially one such as South Riverdale, which is within 130 meters of 2 schools and 6 daycare facilities. South Riverdale was supposed to have a close working relationship with local police. It became clear after the shooting that its relationship with police was an antagonistic one. As a result, an outdoor drug market formed around the building. Drug dealers sold and users used with impunity in that safe zone. Almost 100 children on my street could not take the natural route to school because a violent outdoor drug den replete with armed dealers existed in the space between a community health center and a church. Outreach workers are not going to prevent the natural consequence of bricks and mortar supervised injection sites, which is a very concentrated area of drug dealing, drug use, and drug waste. The province would not grant South Riverdale a license for a cannabis dispensary given its proximity to schools and daycares, yet the management of that CTS site allowed an obvious outdoor fentanyl marketplace to cultivate on its doorstep for years. Such a marketplace did not exist there prior to the existence of the CTS. It's worth noting. Outreach workers would not have fixed the fact that many members of my community were voicing strong concerns about this outdoor drug den to both the center's community liaison committee as well as to the director of the CTS going back to at least 2019. We were never heard. My forthcoming reporting will also reveal that CTS staff encountered the same lack of response when complaints about drug dealing and the diversion of safer supply were registered to management. South Riverdale received $9.5 million in federal SUAP safer supply funding between 2020 and 2024. Coincidentally, the CEO of the health center received a 27% pay hike in 2020. Outreach workers are not going to incentivize senior management to report complaints that could eliminate or decrease funding. What CTS sites need is not outreach workers, but independent management that is A, not connected to or benefiting from the funding, and B, not mired in us versus them harm reduction ideology, whose code is to protect drug users at the expense of everyone else, including presumed NIMBYs who don't want their children to be exposed to potential violence, open use, and discarded needles each day while walking to school. The phrase evidence-based is ubiquitous in harm reduction advocacy. Where evidence is severely lacking, however, is when it comes to the impact these sites have on those who live around them. Key crime indicators were not lowered in South Riverdale because of our CTS site. It's quite the opposite, in fact. Priority 1 911 calls within 200 meters of South Riverdale's health center recently rocketed upward by 900%. The police forces of Ottawa and Toronto do not have the capacity to act as private security forces for their CTS sites. Morse Street Junior Public School is half a block from the South Riverdale supervised injection site. Morse's schoolyard was recently refurbished. It's one of the most used areas in Leslieville. Families host birthday parties there on weekends. Unfortunately, because of liability and safety concerns, that schoolyard may now be locked and gated during non-school hours because of users leaving needles on the soccer pitch and in the wood chips, which happened to the school beside the safe injection site on Queen West on the west side of Toronto recently. How did the health and well-being of about 50 clients of the CTS site override the health and well-being of thousands of children who regularly use that space? Instead of just asking for more funding to help pick up needles, as in 2D, how about re-examining the way millions of needles are distributed in Ottawa? We've asked the same question in Toronto, and Toronto Public Health is actually listening to that request. Why not explore a mobile service that would deter drug dealers from congregating in the same space every day and allow for more reliable needle retrieval? After
Derek,
all,
you
public
are
health agencies, I have one sentence
Derek,
left.
apologies, you are at time if you wanted to take a few
I have
moments
one
to wrap
sentence
up.
left. After all, public health agencies are responsible for the consequences their biohazardous waste cause to society's most vulnerable, its children, not schools and parents. Thank you.
Thank you very much for your delegation. I am not seeing any hands, but appreciate the time you took to speak to us today. Thank you.
Thank you.
Next, we have Jen P.
I'm not Jen P. Unfortunately, she was unwell. My name is Wendy Muckle. I used to work for Ottawa Inner City Health, and I do know what Jen was going to say, so I thought that I would come and say it. Jen is a member of what's called the Block Leader Program, which operates in the area around Shepherds of Good Hope. And for people who don't know about that program, it was developed by people who use drugs and people experiencing homelessness under the leadership of the Byward Market Balance Community Task Force. And it was really an effort to engage those members of the community who were considered to be central to social disorder in the Byward Market in an effort to see how they wanted to get involved in making the community better. And it turns out that they were very interested in making the community better, and every day block leaders are out on the streets in the Byward Market doing a whole variety of things intended to make life better for their own community and also for their neighbors, the businesses and visitors. And actually, I did want to start by just thanking Ottawa Public Health, because one of the things that we had set as a goal for ourselves way back in March when we first started meeting was actually having a voice and having impact and having important people hear us. And so here I am in a room of very important people. And many of the suggestions that came from our community are actually reflected in the report. And I know that most of you expect that people will listen to your voices, but when this group first started meeting back in March, they were angry, they had very disillusioned and had the sense that they were both invisible and not being heard at all. And so they set a goal for themselves of figuring out how to speak with a voice and figuring out how to get people to actually hear what they had to say. And I think it's not usual that when you tell people that their ideas are reflected in an Ottawa Public Health report that you get cheering. But last Friday at one of our community meetings, when I explained to them what had happened and that we would be speaking in support of the report, we actually had cheering. So congratulations to Public Health on the inclusion and the anti-oppression and anti-stigma. In the report, there are many things which we strongly agree and support. Certainly, there's a number of suggestions around practical supports that are really helpful in terms of keeping people alive. The addition of services for people that smoke drugs is a huge priority for us. Unfortunately, last night, one of our block leaders died of an overdose after smoking in the parking lot. And we lost somebody the week previous to that and somebody the week previous to that. It's a never-ending battle of grief and loss for our community, and we are struggling on despite that. But we really strongly believe that those practical supports are things which should be available to people right across the city and really should be available to anybody who needs them. They shouldn't be something that's done as a favor for people who use drugs. There's something that should be part of the continuum of care that anybody who uses drugs should have available to them. One of the things that's in the report that was really important to us was the focus on anti-stigma and the focus on strengthening community, and really also the focus on helping us deal with our grief and loss. We lose somebody, as I've said, at least every week. We are always reeling. We really, have no place even anymore to put our grief. And you're seeing in the city what happens when the only really reliable thing to help people deal with their grief are the very illicit drugs that kill them. And one of our strategies as a community has been to try to strengthen our community and recreate human connections and recreate the kind of compassion and support so that people can reach out to each other when they're grieving and not always have to turn to fentanyl as the one, only, and ever present thing that helps people get through the day. So we're really pleased about this report. We're extremely pleased to see many of our recommendations reflected here. And we're really pleased to have the opportunity to continue to work with Ottawa Public Health and many of the other partners. We are ready, willing, and able to do many more things to bring overdose prevention and overdose response to the most vulnerable in our city and to save lives and reduce harms. So thank you very much.
Thank you, Wendy. We've got a question for you from Member Gower.
Thank you for your presentation. I'd never heard of the Block Leaders Program before. I was wondering if you could give us maybe one or two examples of what kind of activities or initiatives the leaders have carried out.
So the Block Leader Program is a leadership development program, and we're really trying to restore the leadership that used to exist in the street community and to restore the social structures that used to exist. The street community used to have a way that things worked and a hierarchy and a set of rules within the system. For example, you never use drugs in front of children. And when fentanyl arrived in 2017, everything went out the window. The community was decimated. The leaders that we had died of overdoses. They weren't able to be replaced. And all of a sudden it was an every man for himself and there's no more rules anymore. So the block leaders are people from that community. They're members from that community. They attend a training, which was developed by the community. And then after they have been trained, they're eligible to be able to work for the community, and they're paid to work for the community. And they do things like, over the summer when it was hot, they were taking water around to people. They help people get a bed in the shelter. They hand out socks to people that don't have socks. They do cleaning the garbage was a problem which bothered everybody in the Byward Market. Whether you were somebody who used drugs or you were somebody who lived there or you were a tourist, the garbage was not a good thing. They pick up, in October, they picked up 1,162 bags of garbage from the Byward Market. So they pick up garbage, not because they're a garbage picking up service, but because that's what neighbors do for each other. They help keep the community clean. And so they're really taking this leadership development program as a neighbor to neighbor. They're trying to be better neighbors themselves, and they're trying to encourage the members of their community to be better neighbors to others.
A fascinating program. Thanks for.
It's very exciting to have the privilege to be part of it.
Yeah, thanks for telling us about it tonight.
Thank you.
Thank you, Chair.
Thank you. Thanks. Thank you for being here. Our next delegation is Stephen Wilcock.
Myself. There, I've unmuted myself. Can you hear me now? Still not? I'm not hearing you. Just nod if you can hear me and I'll just carry on. Okay. Thank you, Tammy. My brother-in-law says as soon as someone starts a statement with, I'm not an expert, he tunes right out. But I would like to start by saying that I'm not an expert, but here's what's concerning me. Like Mr. and Mrs. Dutriot of Sandy Hill, I have concerns, we have concerns with the deterioration of our neighborhood. Our neighborhood is called Vanier, in particular, a small park called Kingsview Park. I'm the first person to mention Vanier tonight, and I'm kind of surprised by that. I lack Carol Dutrio's eloquence. I also lack Councillor Plante's command of the data. I agree with Calla that community consultation is generally a sham, and that it appears that all your attention is patient-directed and not community-oriented. Derek Finkel, as far as I'm concerned, said it all. Someone said earlier that if you build it, they will come, and they are coming. They're coming to Vanier from Orleans, from Sandy Hill, from Kitchissippi, and every suburb. If you concentrate your treatment centers in one part of town, that's where the addicts will go. Addiction mitigation is a growing business, and it's centered disproportionately around the downtown core because that's where all the social support agencies are concentrated, as are the private companies licensed to distribute without accountability highly addictive substances. Maybe some people come to Vanier for treatment, but here's what happens on the street outside Respect RX and Recovery Care on Montreal Road, 45 Montreal Road. The clients take their vials of pills. We have evidence of 60 doses of Dilaudid given to one patient at one go, a single go. There's someone, usually on a bicycle, to meet them just outside the front door and bring them just off the property of Respect RX and arrange a trade. The trade is usually for something that's inhaled or injected, and it usually sends its user into that near-death experience or whatever it is that causes them to stoop over or pass out. The patient generally doesn't do it right there. They do move all the way over to the Esso station about 4 doors away, where in the parking lot they consume, or they'll go to the alleyway down the other side of the street, or the park by the river, or literally in our backyards. Never mind NIMBY, this is literal, all right? It's not happening with such frequency in other communities. And why is that? Because we have these private companies distributing the very currency that gets fentanyl into the hands of our most vulnerable. This is where the overdoses have been happening. Montreal Road is now considered unsafe in broad daylight. It was perfectly safe before Respect RX got there. So we would request that greater vigilance be applied to the private entities attracting our most vulnerable. As long as we have business institutions supplying drugs that are being redistributed on the street without transparency or accountability, and I have to underline that because we had 2 representatives from those 2 businesses at a community meeting who could not account for the amount of Dilaudid they were pushing out their doors or even the number of people they were seeing on a daily basis. We would like greater vigilance, surveillance, inspection of whatever it is these people are doing. There are a lot of problems. It's a complex issue, and I applaud so much of what I've heard tonight. I've learned so much, but I've just given you a snapshot of what's happening on the street, and I'd like you to take that. That's all I had to say. Thank you.
Thank you very much for your delegation. I'm not seeing any questions, but appreciate you being here. Thank you. Our final delegation is Dr. Dirk Heyer.
Good evening, everybody.
Yeah, we're just getting your presentation up on the screens. Just give us
Sure.
one.
I can get started while that's going, recognizing the late hour, and don't want to have another motion made. So thank you very much. I'm the chief coroner for the province of Ontario, and I've listened throughout the evening and certainly heard what we all have spoken about, which is this is an ongoing tragedy that will require collaborative work together and everybody pulling together in the same way to try to figure out how to address the challenges that many people who are suffering with drug use can be assisted. So we go to the next slide. I think you heard earlier, and all of you have said this, we spend, unfortunately, the work that we do of looking at deaths on an ongoing basis. And we see approximately 2,500 people who pass per year in Ontario. And they're all people. They all had friends. They all had families. They were brothers, sisters, mothers, fathers, sons, daughters, and all were members of communities like everybody is. And so we want to acknowledge that and recognize that. They're all often young. The majority are young people, so there's many life years lost, and it really is something that is a preventable problem, but very complex and no easy solutions. What I talk about today is just for a few minutes, and we'll go to the next slide, is how does the overdose or the toxicity data come forward? Well, we investigate deaths. We investigate deaths when particular concerns happen, when people pass away suddenly or unexpectedly, or from things like substance use or substance-related death. We can move to the next slide. And the way we approach it is to answer the questions of immediately what happened. So who died, where they died, when they died, what was the medical cause of death, and then trying to understand the mechanism. And then that's the first and most important part, to be able to give the answers to the families, to those who are nearby, to communities, to understand what happened. But then when we look at many different deaths occurring, we will bring those voices together. So each individual voice will come together with the others as we aggregate the data and we put it all, the information together. So look for trends, patterns, and anything that we can bring forward to help to inform prevention. And that's at a systemic level, and recognizing that systemic level then needs to work together with the community to be able to figure out how to do this most effectively. Next slide. And we'll move to the next slide. This is, I'll leave this presentation for people to take, but it speaks really about what we do is we learn information and we try to share that forward. And one of the key focuses we bring to the attention of others is what are the determinants of health, and often social determinants, but there's other determinants as well. And we bring those and we try to learn about those. Who died, where were they living, what was their ethnocultural background or their identity, what were they working, what kind of work, had they been born in Canada, what other aspects of where they live, and you've heard some of that as things were provided earlier, to really understand the patterns of mortality and really bring forward the information of evidence. And you've heard others say this, evidence-informed population health initiatives. So taking all of that information brings together a focus of people to be able to work forward, those who are in a position to make change, to bring those changes forward informed by the learnings that we have. Recognizing that we're late in the day, I want to stop and provide opportunity for questions. Really, what I have seen over time is sadness of continuing to count the tragic loss of people, and there of young people, and the challenge that I've seen in trying to, for those who are providing care, to figure out the continuum of care and work along that continuum of care, stabilize people's lives, allow them that opportunity to find a personally one that works for that individual for the type of care that they should have somewhere along the continuum. So I'll stop at this point. I see a hand up.
Thank you, Dr. Member Gower.
Thanks, Chair, and thank you as well for being here with us. One of the things in our recommendations today is about writing to the province to request that your recommendations around expanded drug checking are supported. I'm trying to understand what barriers there might be to the province approving that or supporting that from your point of view.
Yeah, I can't speak for the province, but what I can say is drug checking has been recently expanded through the Toronto Drug Checking Group, has been expanded to other areas of the province. There was just funding announced for that. But the benefit of drug testing in our perspective, or what we've learned from the drug testing from a factual point of view, is really gives us an understanding of what drugs are present in the supply, which helps us to understand, unfortunately, how the people might have died. But the drug checking provides the opportunity, though, for those who are people who use drugs and people who are intersecting with them to think about what are the proper treatments to provide and interventions. Because as you likely know, fentanyl being an opioid will respond to naloxone, although it may take more than an individual dose. But something like atizolam, which is a class of benzodiazepine, will not respond to that because it's a different class of drugs. And there are other new drugs right now that are coming, and we're seeing them in unfortunately, the people who pass, xylazine and nitazenes, that also will not necessarily respond as effectively or at all to the naloxone.
Okay, thank you. And do you have any advice for our board of other initiatives, other areas to focus on that you believe could have the biggest impact?
Well, I think I think the biggest thing I can advise is that people work together, that they collaboratively come together and work and think through what are the strategies that are going to work, because it needs to be a continuum of care. And there's no simple answer to any of this, but everybody who cares, everybody who's impacted by this, everybody who understands the significance of the mortality that we are seeing, it's 2,500 people a year dying and they're all young, is how they can come together and bring ideas. Like, you know, we're seeing some of that in this meeting right now, people bringing ideas together and thinking about how to do it and making sure that that continuum is there and that people respect that there, and I'm not saying anybody's being disrespectful, I'm talking about the approach, respect that there's a range of different types of interventions that are required, well, that should be offered, let's put it that way, that should be offered to those who wish to avail themselves of that and to make that service available.
Okay, thanks very much. Thanks, Chair.
Thank you, Member Gower. I'm not seeing any other hands, so I just wanted to ask you, obviously you have a provincial view on the situation. Is there anything unique that you're seeing in the data that pertains to Ottawa that's unlike the rest of the province?
I'd have to take that back and do more analysis, and I can tell you the Ottawa group is, Ottawa Public Health is proactive with us, and they've been working together with our organization to obtain a greater amount, a greater depth of data from us, and are doing specific analysis to really try to understand things with the lens of Ottawa. So I think that I defer to the Ottawa folks. What we are seeing is continued increase of deaths, but similar as far as the numbers. There are some pockets that I would defer to Ottawa Public Health to think more through, though.
Okay. Thank you very much. We appreciate you being here today.
Thank you for allowing me. It's an honor to be here. Anything that we can do to try to help people who can benefit from the help that's available.
Thank you so much.
Okay.
That concludes our delegations. If members have questions for staff on the presentation, we'll invite them back. Yes, we do have questions. So if the team could come back, that'd be great. Thank you. Great, thank you. Member Gower.
Thanks, Chair. I wanted to give the opportunity to staff or ask staff if they can respond to some of the concerns we heard about community safety and community consultation. I think I'll just leave it at that as an open-ended request, if you could comment on that aspect of what we've heard tonight.
Sure, thank you for that question. Through you, Chair. We really appreciate, first and foremost, just all the delegates who came to speak. We heard from community associations, we heard from individual members, and we take that very seriously, and we appreciate the opportunity to speak to that. So firstly, when developing a report like this, there's a lot of consultation that occurs through different channels. bringing this to network meetings where there's 30, 40 partners, bringing this to different community network tables. There's not always an opportunity to speak to every individual. And that's something that we mentioned in the report, that the strategy that you saw in the report, it's not written in stone. This is something where we wanted to show, here's work that's been done to date, here's work that's coming up, and this is an ongoing process. And so part of what we put in the report, that the next steps of this is to do further consultation, is to do further engagement with the community, and that's an important next step. So the individuals who spoke today, as well as many others, we are going to do our best to get their contact information and reach out to these associations and to these folks. We heard a lot of important information today. We heard a lot of, truthfully, really good things that were shared, and you know, we agree with so much of what was said today. And we also want to make clear that we do have a role as public health, and part of that role is to try to reach out and bring others together. Much of what was spoken about is outside of the area that we have direct opportunities to influence or even direct, you know, to others to do, but we can bring this information to those folks. So for example, the community and safety well-being plan, a lot of that was talked about today is going to be things that we'll bring to that group and say, here's things we heard, what can we do together to work on that? We heard things today that would need to be addressed through the Ottawa Police Services. We heard things that would need to be brought to our housing colleagues. So this is a complex and wicked issue, and we will continue to do these community consultations, and we hope and we will reflect on. We didn't want it to sound like this is a closed book. This is very much an open book, and we need to work, and we want to, and we will continue to work with community every step. Thanks.
Thank you, Chair.
If I may, I would add, I appreciated the reflection that we need to be more precise and careful about how we use the term community as well. I think it's true that there are different communities, many, you know, we can't use one word to describe everybody who is a member, you know, person in Sandy Hill, for example, you know, so I think, again, very valuable to hear from people. And I know some of our team members are in different places trying to listen. And I would say that word engagement is probably more preferred than consultation. So like our vision for how we move forward, it would be hearing and working with multiple different, you know, people and communities to figure out what that engagement best looks like.
Thank you to both. Member Brown-Strauss.
Just want to thank the OPH team for, you know, the work to develop the strategy. Like, this is a major crisis, and no doubt this takes a lot of effort. So thanks for your work on that. Just looking at I have a question and then a suggestion. Just looking at the last slide with the list of partners, I realized that there's not a lot of primary care involvement or primary care partners. I do believe that this is one key area where public health and primary care intersect when it relates to mental health and substance use. And I would like to see more primary care involvement. It's going to take, you know, multiple players to solve this crisis, and hoping that you could perhaps comment if there is any plans to engage primary care or what that has looked like on your end.
Thank you, Doctor, for your question. We, on the overdose task force, we have a myriad of partners, and primary care is a group that has been engaged through different channels. Having said that, we do have on our list of next steps different primary care groups. We have a nurse practitioner group. We have several groups that are on the list for our next steps to speak to, but we would also genuinely very much appreciate any inroads and connections in that space. this is something that, as we mentioned, is absolutely an effort by all levels of government, all service providers, people with lived experience. So we would welcome any further connections into that space, but we do have, as part of our next steps, further discussions with primary care. And we have been doing quite a bit of work with primary care around harm reduction work, outreach, naloxone, and much more as well. But having said that, there's always room for more. So definitely would love to have some inroads, connections, anything you have in that space, and we would build that upon our work for sure. Thanks.
Absolutely. And just one other comment. One of the slides that you projected showed that 21% of racialized people do not have a primary care provider. And another in another presentation, I saw that even though substance use rates were similar, amongst racial groups, racialized individuals have poor outcomes from this. With that in mind, I just wanted to comment on one of the bullets on your slide that asks, do people live with opportunity and equality? And maybe we should be shifting from equality to equity, because we do need race-based equity in substance use services. Thank you.
Hi, I just wanted to comment to that. Thank you. So in our consultations on the dashboard, we started off with that section being opportunity and equality, because it's viewed as equality of opportunity and the state that we want to get to. It's that everybody has equal access, equal opportunity. And then there's another field within the dashboard that looks at equity specifically, but we're very open to different ideas and aspects if you think that it's not represented well.
Thank you, Member Brown-Streves. Member Gower.
Thank you. I did have one other thing I forgot to mention. Thank you. There's one of the recommendations in the report specifically calls out the need for services in urban, suburban, and rural. And I'm really glad that that is called out specifically for a number of reasons. One is the concern about concentration of services in one area of the city, but also obviously it is a need all over the place. And I wanted to mention an example of that. Chief Poirier mentioned it at the Ottawa West Four Rivers. They have developed a concept for a mental health urgent care center in the West End, likely in Canada or Stittsville, to serve the western suburban area, in addition to the broader rural area going out to Arnprior and Carleton Place and Almont and beyond. Right now for youth who are struggling with mental health, they may go to CHEO, and then if they live in the West End, they're being referred to services in the East End in Orleans that are only available during the daytime. And it's almost impossible for families to be able to access those services. So for a broad number of reasons, it is important that we have a focus citywide. We've spent a lot of time, rightfully so, talking about downtown and inner city tonight, but the need is certainly high across the whole city. Thanks, Chair.
Thank you, Member Gower. Not seeing any other questions. Dr. Etches, I know you took lots of notes during the delegation, so I just want to invite you if you had any reflections you wanted to share.
It's true. I take notes. I reflect on it. I think I would like to conclude by recognizing there are some common themes here that we heard from everyone that inspire me that we can get to a better place. So definitely common theme about sadness and concern about safety, and lots of people willing to work together and wanting to be part of the solution. So I think that we can work with that. I think we'll be able to make progress as a community. I just want to thank everyone who came out and everyone who worked on report and all the partners who work every day with that same commitment. Things can get better. We know that we focused on overdose today, which is really quite it's one of the worst outcomes, often related to mental health. And so just again, that this is a piece of the work overall to try to promote well-being and mental health. And we do see major challenges, as our dashboard was trying to point out, some of the determinants of our health, you saw other reports tonight spoke to the challenging economic circumstances people are in, the housing pressures, difficulty people have to buy food. So a lot of pressures on mental health, that even go beyond this specific overdose strategy. And we'll continue to, again, work with many of the same partners on those more upstream prevention and policy initiatives too. So thank you.
Thank you, Dr. Etches. I just wanted to add my thanks to everyone who came out to speak this evening. I want you to know you are being heard by this board, and we all wear multiple hats in terms of our work here, but elsewhere in the community, whether it's as counselors or through our work for our volunteerism. So we will carry these reflections into other spaces. And I did just want to salute those who are providing frontline care in tackling the overdose crisis in our community. You are providing life-saving work under incredibly challenging circumstances. So just wanted to acknowledge that and thank you to the team for presenting today. So we have several recommendations. I apologize, it is a bit lengthy, but I will read them out. That the Board of Health for the City of Ottawa Health Unit, 1, receive for information, an update on the strategic work by community partners and Ottawa Public Health on overdose prevention and response across the lifespan and next steps. And B, Ottawa Public Health's collaborative efforts to inform system and service planning through the Ottawa Mental Health, Addictions, and Substance Use Health Community Dashboard and improve timely surveillance of the drug toxicity crisis through the overdose reporting tool. And 2, request that the Chair of the Board of Health write a letter to the Ontario Minister of Health and the Minister of Children, Community and Social Services recommending that they increase sustainable funding for the Healthy Babies, Healthy Children program to support perinatal mental health, substance use health, and infant and early childhood mental health, including the prevention of adverse childhood events. B, advance the regional coroner's report recommendations that align with Public Health Ontario's evidence brief to expand drug checking services in Ontario towards safer drug supply. C, explore innovative options to expand availability and access to health, mental health, addictions, and substance use health services, including harm reduction services such as supervised consumption services across geographical areas to ensure that urban, suburban, and rural residents have access to these services. D, increase sustainable funding for harm reduction service providers to scale up community outreach services to address concerns of neighboring communities, including peer-based programs to support both resident and client engagement, connection to services, and harm reduction supply retrieval programming. E, advance the regional coroner's report recommendations to update provincial regulations and sustainable funding for safer inhalation services available throughout the year to work towards reducing deaths caused by inhalation of substances. F, implement the Canadian Centre on Substance Use and Addiction call to action for grief and trauma support for people who use drugs, their family members and loved ones, harm reduction workers, and community members affected by substance use to support people negatively impacted by the drug toxicity crisis through increased sustainable funding. G, support Ontario Health to prioritize the collection and use of socio-demographic data to better inform equitable system and service planning. And H, increase sustainable funding for First Nations, Inuit, and Métis mental health teams, Inuit family health teams, and the Ottawa Aboriginal Coalition Indigenous Mental Wellbeing Strategy to enhance mental health and substance use health supports and services for First Nations, Inuit, and Métis communities, including the development of new Indigenous family healing lodges. And 3, direct the Medical Officer of Health to share this report and data with the city's Community and Social Services Department to inform their community safety and wellbeing plan. which includes the following priority areas identified through consultation: mental well-being, housing, financial security and poverty reduction, gender-based violence and violence against women, discrimination, marginalization and racism, and integrated and simpler systems. Had we already carried the technical amendment? We didn't. So can we carry the technical amendment? And is the report carried as amended?
Carried.
Thank you, everyone. Okay, there were no other held items. So motion to adopt reports. Member Gower, please.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Ottawa Public Health Update on Ottawa's Overdose Response Strategy, Update on Health Equity, Diversity, and Inclusion at Ottawa Public Health, Nutritious Food Basket 2023 and Food Insecurity Report, Ontario Public Health Standards 2023 Risk Management Report, and attendance at the Association of Local Public Health Agencies Fall Symposium be received and adopted, and be it further resolved that the report titled 2024 Draft Operating Budget for the Ottawa Board of Health be tabled for consideration at the Board of Health meeting of December 4th, 2023.
Carried.
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 Thank you. There are no motions requiring suspension of the rules. Are there any notices of motions? Seeing none, confirmation bylaw, Member Gower.
Be it resolved that confirmation bylaw number 2023-6, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of November 6, 2023, be read and passed.
It's carried. Thank you. I believe there's no inquiries. So we will adjourn. The next meeting is Monday, December 4th, 5 p.m. Thank you, everyone.